a disclaimer basically saying, I'm not treating you all. I'm not telling you how to treat yourself. I'm giving you information that you can take and take it back to your physicians, take it back to your doctors, and figure out what you need to do there. So what is cancer? Cancer is a complex disease of cellular dysfunction and dysregulation. So the important part in this is that dysfunction and dysregulation, and I'll get into that and I'm going to explain that probably ad nauseum here. We got cellular dysfunction. So when we talk about the cell is 37 trillion of them make up your body. And each cell has its own role and thing that it does in your body to function properly. When we're talking about dysfunction, you can have abnormal growth and division. You can be resistant to cell death. So usually a cell has a lifespan. It comes up, it grows, it does its function, and then it dies. Sometimes they refuse to die. They just kind of keep running this bad function over and over and over again. They have altered metabolism. And altered metabolism basically means they use energy in a way that they shouldn't. So usually they actually use way too much energy, which accelerates them and speeds them up. And then they get to genomic instability. And what that means is normally your cell divides, and when it does, your genes inside of it divide and make two new cells. Divides, makes two new cells. In this case, whenever it divides, the genes are not correct, and it starts getting abnormal genes in it. So those are the four places that your cellular dysfunction occurs. In dysregulation, so when we're talking about dysregulation, we're talking about loss of growth control. So either they're growing slow or growing fast. Most of the time in cancer, they're growing way too fast. We have tumor suppression. Tumor suppression occurs within the cell and also occurs with the immune system. But tumor suppression, basically, we lose the ability to realize it's a bad cell, and the cell continues to grow. And then it bypasses checkpoints. And I'll get more into this in just a moment, but basically your body has regulations that it has to follow. And so sometimes that cell takes a bypass and goes around it. So it's kind of like truck drivers here in Wyoming. When they know there's a way station or a checkpoint, they take the outer road. Cancer does that. So what causes cancer? Basically, it's when the cell breaks the rules is what happens. Who makes the rules? Your genes make the rules, and your immune system makes the rules. That's exactly who's important in cancer. Those are the two things that predict whether you're going to get cancer or not. So what are genes? Genes are little recipes that are basically half of it comes from mom, half of it comes from dad, and it makes programs to make proteins. So everything in your body consists of proteins and some fats and carbohydrates. But proteins are what really makes the functions happen in your body. So your DNA makes these proteins. Basically, your biological parents give you both sides of your DNA. So you have a gene, half's from mom, half's from dad. Mom and dad can both give you a good gene, good halves. One give you a good half, one give you a bad half, or both of them give you a bad half. And it makes a difference in how that plays out. You have 20,000 to 25,000 genes in your body. And so that sounds like a lot, but compared to the number of cells, that's pretty small. So genes are the start of the foundation of everything. Your body is programmed by these genes. So it would be kind of like if you went into the kitchen and somebody said, okay, I want you to make cookies, and they had just stuff laid on the counter. If you didn't have a recipe or some knowledge of it, you couldn't do it. The genes give the recipe, they give the knowledge to build your cells. In this case, when we're talking about cancer, there are three kinds of genes that are extremely important. You got the ones that control the speed of how fast cells multiply. Those are proto-oncogenes or oncogenes. You have suppressor cells, tumor suppressor cells. They are like the brake. So the first one's like the accelerator, the second one's like the brake. And then you got repair genes. And they are ones that fix mistakes in this. So the oncogenes are proto-oncogenes. So oncogenes means cancer. Proto means before. So before they become cancer, their role is to make normal cell growth, division, and differentiation. So their job is basically how fast are we going to move things forward. And so they are the accelerators. They're the amplification genes. When they begin to break, or when they're wrong, they go from proto-oncogenes to oncogenes, which means cancer genes. So these are the ones that basically set the pace of how fast we move forward. They're the accelerators. These are the most common oncogenes, so the most common ones that cause cancer in individuals. And when you look down through here, there'll be other ones you see later that maybe you thought they would have been on this list. But the big one that you'll notice is the HERS gene. A lot of times they'll test and they'll say it's HERS positive, HERS2 positive, HERS2 negative. And that's because that gene is famous for breast cancer, stomach cancers, that kind of thing. And that's why it's there. But there's a number of other ones here that we see these show up a lot of times when we're doing genetic reviews for people. We'll see these genes show up, and it doesn't mean that you have cancer. Doesn't mean that you're going to have cancer. It basically means that your likelihood of having cancer or having cells accelerate too fast is much higher. This past 3 weeks, I've done multiple gene reviews on people, and that MYC gene has come up a number of times on the people. Probably 3 out of the last 5 or 6 people I've done. Tumor suppressor genes. These are the brakes. So even if you have an oncogene, and it's saying go fast, subdivide and everything, these genes here say nope, they're the brakes. They slow stuff down. So a lot of times, just because you have one kind of gene that's bad, doesn't mean you're going to get cancer. It's kind of when the multitude starts piling up and you have a lot of checkpoints breaking. That's what's going on. So these tumor suppressor genes are like the brakes. They slow down things, and when they're wrong, it actually accelerates things is what it does. The most common tumor suppressor genes are your BRCA genes. They're one that everybody knows about breast cancer. If you have one of these BRCA1, BRCA2 genes, your likelihood of having breast cancer goes up significantly. But in the case of pancreatic cancer, this is probably the leading one, and nobody talks about it. So this is one that shows up too on the genetic reviews. And then this TP53 gene, this one, some of the things, if it's broken, if mom and dad both gave you a bad gene on this TP53, your likelihood of having cancer in a normal average lifespan is about 90%. So it's a pretty significant gene. So when it's not working, all the brakes are turned off and things are full steam ahead. And so this is the one where you see with people, maybe they've had cancer when they were 30, and maybe it was some kind of bone cancer. They come back, they have breast cancer when they're 50, and then they have something else when they're 60. It kind of just lingers on. And so that's when I see people have this one here, we recommend a number of tests and things to keep an eye on cancers. The DNA repair genes, these are also tumor suppressor genes. They just are a subclass of it. They are the ones, pardon me, they are the ones that basically fix mistakes when your cells are dividing. So you have your DNA, and whenever you go to make a new cell, it has to divide and be copied. When it divides out, now you have this one, and a new one's made next to it. But when it's being made, sometimes there's little errors in the middle of it, and those errors have to be replaced and corrected. So they are the repair crew. When they're not working right, we begin to have DNA that doesn't function properly. So these are really the basic genes that come with it and what they do. So if we are making a new gene and this is supposed to be an A, the thing sticking to it is supposed to be an A. If it makes a C, the first gene comes along and says, this is an A, this is a C. Oh, pull it out, put an A in its place. It also has one that the glue between them can be broken, and so it comes down, they're supposed to stick together, and it rips apart, and basically it sticks it back together, kind of like a zipper being broken, puts it back together. And then we have base repair. So sometimes when they're snipped or broken, it falls apart, it glues it back together, like both of them together. And there's other ones that have to fix the ends. So when the ends fall apart, they have to fix the ends of it. So these repair genes are basically what makes your copies correct. When you don't have this correct, when you make a copy of something, it can be totally different. So you can start out with a good cell, you're young, everything's going great. You get older, and the same cell you had when you were young isn't the same thing when you get big because these repair genes are broken. So what causes these genes to stop working? Well, first of all, they may not be working from the get-go. Mom and dad may have given you trash genes. They may have given you bad genes, and so you congenitally or you inherited these things, and they don't work properly. Recently, I had a patient who actually had genes that were not like mom's or dad's. So along the way, whenever the sperm and the egg were coming together, they didn't get put together properly, and so he was missing genes. Well, interesting enough, our bodies are incredible enough that he'll just go try to make a gene and says, well, I think this gene is for this, and make it. And so that's kind of an interesting thing that I hadn't seen before. But the individual is doing pretty darn good considering he's different than everybody. I said, well, your genes must be superhero genes because they don't match anybody else. I said, have you figured out whether you can fly or see through walls? Right. Another thing that causes these genes to not work properly are random mistakes. So I just talked about those dividing up, and each time it has to make the same copy. Well, you think about how many times that's been copied over by the time we get to our age. It's incredible that it could do it. You know, even in our factories, if you have a press that's pressing out maybe a fender of a car, it could not press out a fender of a car as many times as our cells have divided in our lifetime without wearing out. So the fact that we get to where we are and we're taking these out every day, every 50 days, whatever it is absolutely phenomenal. So these random mistakes happen, and the repair cells are supposed to be there to fix it. Then, the big one is environmental factors. So tobacco, and these are kind of listed in what the world thinks are the most important. I think we could probably argue in different areas of the country, different areas of the world, this is probably a different situation. But tobacco smoke is still the number one killer for people. People that smoke, the chance of cancer is extremely high, lung cancer, and then other parts in the body after you get past a certain point. UV radiation from the sun. It's interesting. There are probably just as many studies saying that sun's good for you as there are saying sun's bad for you. And the catch is, it's probably somewhere in between. My functional cardiologist, he did a talk on this. It was about an hour, 2-hour talk. And the take on it was that your skin actually has to get calloused just like your hands. My poor little doctor hands are nothing like they were when I did construction. And if I go out now and I dig a hole too long, I get blisters on it. Well, if I go out and dig a little day, dig a little tomorrow, dig a little the next day, I have calluses within a couple days. Your body's the same way with sunlight. If you go out in the sunlight and you get a little bit today and then go back inside and you don't get burnt, next day you come out, you can go a little longer, next day you can go a little longer, and you're fine, except for if you've already had a situation where you've been burnt too many times, then you can set off a cancer that's already there. So in general, sunlight is good for you as long as you haven't taken it too far, kind of with everything. Viruses. It wasn't too long ago that we finally discovered that viruses cause a number of cancers. And so that's why now they have the vaccine for Gardasil for kids, is because they found that the HPV causes testicular cancer, cervical cancer, and so they're trying to keep people from getting HPV. There's some mixed results on how well that vaccine's working for that, but that's what started that whole idea of that. Well, then they come back and they started finding out that people that had hepatitis B and hepatitis C, even though they now have treatments for those, they found out, oh, they got it, and now they're getting cancer later on. So they found, okay, maybe these viruses do things. And Epstein-Barr, which is mono. People that have lingering mono tend to end up with certain cancers that come from that. Industrial chemicals. Almost everybody knows about asbestos because you see mesothelioma commercials all over everything. They still use it in a number of industries. It's a good heat blocker for kilns and things like that. And then formaldehyde. Formaldehyde, believe it or not, was most of the people working in the medical industry were using formaldehyde to preserve things and ended up with this situation, this taxidermist, things like that. So now they use citric acid, other things to preserve. But those are two. A lot of other industrial chemicals are actually used in our foods here in the United States. We have a situation with the FDA where they have allowed now for several decades what's called one-dose toxicity. So that means an industry can put pretty much anything they want to in your food. There's a few limitations. Anything in your food, as long as one dose doesn't make you sick. The catch is, one dose is considered one serving. And so if you look at a bag of potato chips and you start looking at the benzoic acid, you start looking at those things in there, which are poisonous, you're getting lots of those. Because if 8 chips is a serving size and you sit down, nobody eats 8 chips, nobody eats 8 corn chips, that kind of stuff, you go over it real quick. So we're getting a lot of industrial chemicals that way. A lot of our food colorings are actually petroleum byproducts. They're actually what they couldn't sell, what they couldn't do with, they clean them up and make pretty colors out of them. So the industrial chemicals are getting into our food system. Ionized radiation. This can be from your x-rays, things like that. It can be nuclear radiation. Outside of St. Louis, I just heard on NPR the other day that they're trying to clean up the nuclear waste site there from the Manhattan Project. But the people there have a super high rate of cancer in that area, and they finally are starting to get some help with it. The ionizing radiation, another one, I read on New Atlas. It's a thing that comes out with new research. DARPA is a U.S. Radiation that we use for finding airplanes in the sky. We also just started using it as a signaling device. We just sent the fastest signal around the world using this, and we also transmitted energy for the first time that was highly successful. We sent up energy out of this place, satellite, and came down and powered things on the other side. And it's actually ionized radiation. So we're doing it to ourselves, a lot of things. Flights, if you take a flight from here, you get in the plane and you go across to Europe, you're getting more x-rays in that flight than you would be if you went back and had an x-ray here in the clinic. So it's significant. A lot of your captains have, or a lot of your pilots are lined with lead. So they're up there all the time and they'll get it. The poor stewardess get bombarded with radiation all the time. And they do have a higher rate of cancers. And then chronic inflammation. I would probably have moved the chronic inflammation to number 1. I probably would have moved viruses and infections to number 2, and then tobacco, if I was choosing exactly what I wanted. So important to know, while your genetics kind of set your predisposition for things, they are not the major role in this. It's actually the environmental exposures. So even though mom and dad gave you something that can lead to cancer, it's what you do with it that makes the difference. That's important to know. Okay, so just a few cells make a big difference. But every day in your body, you produce about 37,000 or 37 trillion different cells that are there. They're occupying the space. And out of that, every day, you have 10,000 to 100,000 of them that don't quite multiply out right. They may not be cancer, but they're not right. And so I went and did the calculations. That's 0.000000027% of your cells every day that are not made right. Out of all those, you end up with every day you have about 6 to 8 of them that are actually truly cancer cells. In a normal everyday person, you're producing 6 to 8 cancer cells every day. So if somebody says, well, I don't have cancer, you can pretty much say, well, yeah, you do. You're just going to take care of it is the difference. So in that case, 0.0 and 10 zeros, 1/6% of your cells are cancerous at any given time. So if we have that, how the heck are we making it, the age we are without having a problem? Our body has a second system that takes care of cancer. So we talked about the genetic system. Now we're going to talk about sophisticated immune system that fixes this and takes care of it. So in general, our immune system has a number of functions that it does to fight off cancer. First, it goes around looking for cancer cells. It goes looking for bad guys. It goes looking for viruses. It goes looking for parasites. It goes looking for anything that's not right. And basically, its main job is, once it finds it, it tries to destroy it. It tries to kill it. And so that's the way it works out. Then it tries to also create an equilibrium. So when things are moving too fast and rapidly expanding, it says, nope, let's put on the brakes here. Let's slow this down. We need to make sure what you are and what's going on. So it's kind of like the checkpoints. The police, they're out there and people are speeding through. It's like, nope, slow down. Hey, you doing okay there? Yeah, okay. So it's kind of a checkpoint situation. Then it also takes and looks for the escape cells. Some of the cells make it past this, and it kind of knows they're there, and it goes looking for those escape cells so that it can destroy it later. And cancer has a great way of escape, and we'll get to it here shortly. So the third way is active anti-cancer responses. So you escape, you get past it, it's looking for you, but now it calls in the whole crew and deputizes cells and everything to come fight off the cancer. Once it realizes you're not just an escape cell, you're a whole group of bad guys. So I would kind of say this may be like the ICE team. They say, hey, there's one guy we're arresting, but there's a whole bunch of people here. We're going to go take care of it. Key immune cells and their mechanisms. So we have in our body, we have a number of white blood cells, especially lymphocytes, that their main role is to kill bad guys. They are soldiers, and that's their job. They are the killer cells. So anytime you hear cytotoxic T lymphocytes or T lymphocytes, you know that their job is to go out and kill the bad guy. Now, they have to be told and taught who the bad guy is. We have natural killer cells. And so the difference between these two is these natural killer cells, they float in your body. Nobody really has to teach them who the bad guy is. They just kind of know. So they're the ones standing back all the time, just kind of watching everybody, and all of a sudden says, boy, you look suspicious. And they keep an eye on you for a while. They may even float alongside you for a while. And then once they realize you're there for no good, it's kind of like over in Afghanistan that you had some people on the outlooks watching for bad guys, and at one point they'll say, oh, that person's setting a bomb up. I need to take them out. Nobody had to tell them that. They just had to take their own action. The cytotoxic killer cell is the opposite. He can't do anything unless somebody tells him to do it. So that's the difference between these two cells. The T helper cell. The T helper cell is one that basically has been told what the bad guy looks like. And so he's more of the spotter. He's up with his binoculars. He's looking around. And once he sees a bad guy, he says, that's a bad guy over there. That's a bad guy. And tells the cytotoxic killer cell to go get him. So that's what the helper T cell does. He does this process by using things called cytokines. Cytokines, there's interferons, interleukins, but what they do is they boost the immune system in a certain area. So when the helper T cell goes along and he bumps into a cell that he doesn't know, he kind of stands back, takes a look at it, says, yep, it's a bad guy, and then basically he throws up a whole bunch of flags, he puts the smoke out, and so like a lot of times in the military, if there's something going on, they'll throw out the smoke bomb and say, okay, this is the place we need the bomb to come. And that's what he does. So he throws out all of his chemicals and says, this is the place that bad stuff is happening. Come take care of it. He doesn't really take care of himself. He just tells everybody else to do it. Then we got B cells. B cells, when we talk about antibodies, we talk about when you get a vaccine or something like that, they give you a shot. They put in some little things called antigens, which are proteins. And those proteins basically make antibodies. So your B cell comes along, it basically engulfs the little antigens, which are actually seen on the outside of cells. If you've seen pictures of any virus, COVID virus, anything like that, there's little spikes and things around it. Those are antigens. Those are little proteins, and it marks them as a bad guy. It's kind of like a uniform on them that says, yes, this is a bad guy. B cells make antibodies, which are little flags that stick on the antigens. So if you have all these little spikes on the outside of you as a virus, as a cancer, basically this cell comes along, bumps into you and says, oh, you're a bad guy, and it starts sticking little flags on you to say, this is a bad guy, come and kill it. So once he does that, he can mark them so that some other cells, the T lymphocytes can come in, I'm going to get the other ones macrophage, and then the natural killer cells just know it's a bad guy. It amplifies their ability to see the cancer, to see the bad guy. Macrophages. Macrophages are called big eaters. I always think of them like Jabba the Hutt, just a big slime ball. That's what they look like in your body. And they actually can go in between other cells, get in and out of your blood vessels really easy. And then sometimes, if you look at it in the microscope, you'll actually just see them squeeze almost just straight in between something. You think there was no space there, and all of a sudden they're on the other side of it. Kind of very much like that. Very much like that, actually. Just more of a little jelly thing. So, what they do is once things are marked and killed, they come in and basically surround it, pull it into itself, and then basically eat it up. But once they eat it up, they take those antigens and they put it on the outside of itself. And everything knows that that was a bad guy because the macrophage ate it and it put it on the outside of it and says, okay, this was a bad guy, I ate it, you all need to know about it. So it starts presenting those antigens to everybody else, to the T helper cells, to the B cells, so the B cell can make then flags to go put on them. And so it's pretty important how it works. Now, the macrophages, sometimes they go rogue. They can be bought off by the other side is what they can be. And so you have an M1 macrophage that works just like I mentioned. It comes in and basically presents all the pieces to it, kills the bad guy, and it works out fine. But when they've been paid off and they become bad guys, sometimes cancer puts out some chemicals that make these macrophages, when they're eaten by the macrophage goes, oh, I'm so sorry. I didn't realize you were a good guy. I'm sorry. So then it puts out these chemicals that say, this cancer is not a bad guy. I made a mistake. It's a good guy. So now your body's looking at cancer going, okay, I'm not going to touch you because I thought you were a bad guy too, but the macrophage told me you weren't. So these macrophages can be your saving grace, or they can be your worst enemy. One of the things that makes the difference between saving grace and worst enemy is your overall inflammation state in your body. So when you're highly inflamed, you have diabetes, you have all these other things going on, they tend to go towards M2. When you're healthy, you're eating healthy and things are working properly, they go towards M1 and your body works properly and fights them off. So then we have, I think this is our last white blood cell that comes along. This is dendritic cells. Dendritic cells are more like the octopus. They have lots, dendrites are usually arms and fingers out there. And what they like to do is they like to come along and usually from a macrophage, they'll come along and they'll take the pieces off the outside of it. And it's like an octopus. So they have one in each arm, each leg, and they're screaming at everybody, hey, I got the bad guy. Here's what he looks like. Here's what his uniform looks like. If you see this uniform, this is what you need to fight. That's the dendritic cell process. And it really helps with the cytotoxic lymphocytes. So it loves to go to the cytotoxic lymphocytes and say, hey, I just want to inform you. This is what the bad guy looks like. You make sure and take care. Here's a piece of him here. Oh, this is a little different piece. This is a different piece. You know what he looks like now? Go kill him. So that's its job. There's a number of these actually in the nervous system that work extremely well too. It's one of the things that helps our nervous system know what's good and bad in it too. So sometimes when we have cancers in our nervous system, this cell is the one that's particularly not working right. So now, I started to put this list up to begin with, and I was afraid if I did, without knowing the cells and things, it didn't make sense. So again, the antigens are little proteins stuck on the outside of the cell that tell everybody who it is, whether it's a good guy or a bad guy. Antibodies are flags. Basically, they're the one that your immune cells come along and mark the bad guys with. Then you have cytokines. Cytokines are messengers. They're interferons, interleukins, tumor necrosis factors. So these are chemicals that the white blood cells sprinkle out to alert everybody. So they're kind of like the cell phone system. They go out all through the blood and the body comes back, or the cells come back and find that area. So that's why if we get bit by a bee, basically the white blood cells come to the area, they produce a lot of cytokines and all of a sudden it swells up because all the white blood cells are getting there, all these chemicals are in the area, and they're trying to actually help at one point. Then these last chemicals here are called immune checkpoints. That PD-1, they're one that tells the immune system, okay, you've been busy enough long enough, calm down. Same thing with the CTLA-4. These are molecules that basically regulate the immune system. So they tell it to speed up, they tell it to slow down, they tell it what to do. Let me go to this one here. So in our regular everyday life, when we get hurt, we get an infection, we get hurt, something goes wrong, we have what's called inflammation. Inflammation is usually an immune response. We know it as it gets hot, it gets full of fluid, that kind of thing. But in your body, what it's intending to do is bring more blood to the area, to bring nutrients to it, to take away the bad stuff. It brings fluid so these white blood cells can get in, rebuild, do their job and everything. And for the first 8 weeks, when you have some kind of injury or infection it's called acute inflammation. And acute inflammation's job is to come in, kill the bad guy, clean up the debris, rebuild it back like it was. And that's perfect. And usually it's done by 8 weeks. Sometimes it's done in 3 days. Sometimes it's done, but 8 weeks is about the limit. Once you get out past 8 weeks, now your body has lost its ability to shut off the inflammation. Either you've been hurt so bad that it can't repair it, and it's still trying but can't do it, or at that point, your body lost the ability and it's still spewing out chemicals saying, put more blood flow in here, put more things in here. So when we get to chronic inflammation after that 8-week period, we're in a problem. And if you think back in life, almost everything in your body has healed up in 8 weeks. And what didn't heal up in 8 weeks, whether you broke a bone or you broke something, it doesn't quite heal up right. So 8 weeks is that definitive number right there for the most part. So when we roll over into acute inflammation, bad things start happening. and cancer is one of those things. So cancer's immune evasion strategy. So cancer's main goal is to survive. It's not to kill us. It actually wants to live. It wants to use our bodies to live off of. So its job is not to necessarily kill us. Its job is to do whatever that has to do to survive. So the first thing it likes to do is to lose those antigens on the outside. Those little flags that are on the little proteins on the outside, so we don't know who it is. So it lost its uniform is what I'm trying to say. So it'll first, when it starts multiplying, it gets rid of them. So now it's just a smooth cell, or sometimes if it's picked up on another cell, sometimes it'll put the good cells antigens on the outside and say, nope, I'm a good guy, I'm a good guy. So either it says, I have nothing here to look at, or I'm a good guy. So that's one of the things it does. The next thing cancer does to really start taking off is it downregulates our immune system. It puts out some chemicals that basically makes it invisible to the cytokine thing. So basically it has good camouflage. It's hiding out there. Everybody's looking for it. All the soldiers are looking for it. It can't find it because it basically made camouflage on where it can't see it. Then the next thing it does is it kind of comes into those checkpoints. And a while ago I talked about some of the chemicals that macrophages make. One of the chemicals they made was PD-1. What it does is it comes over and it starts making its own chemical that's called PDL1, which is just the opposite. It kind of covers it up so it can't see it, so that basically it can go past the checkpoint. I used the analogy last night that this is kind of like the fuzzbusters that came out in the 1980s. The cops would have a radar and they could clock you. Well, you get a little fuzzbuster you put up on your dash and basically send out a fake radar signal back, and they couldn't tell how fast you were going. This is the radar buster. This is the fuzz buster that your cancers use so that it can't see you and can't tell how you're going. It goes, I know something's wrong. I can't tell what's wrong because the signal's messed up. Then it creates a immunosuppressive environment. A lot of times this immunosuppressive environment has to do with acidic areas. So your immune system doesn't work very good in an acidic environment. It just doesn't do well there. So a lot of times this cancer, right around it will create a lot of lactic acid. It'll have a lot of acid there, and your immune system cells come in like, I don't think I want to mess with that. It's kind of like if you were going to go look for a bad guy and he jumped into the sewer pit. You're kind of like, I think I'll just stay out and let him do his own thing in there. It's the same situation here. And then the last one, they secrete immunosuppressive factors. So they release cytokines and other molecules that inhibit the immune system from even functioning. So the cancer cells hijack the body's inflammatory process. So they use these things like the macrophages, and I said you can get a macrophage that goes rogue, and that's that M2 macrophage. So cancer re-educates it, basically. It takes them in and brainwashes them and says, nope, I'm a good guy, and you need to go tell everybody I'm a good guy. That macrophage, that M2 macrophage comes along, and it's so convinced that it's a good guy, it actually starts producing some chemicals to make things start growing faster. So it comes in and says, oh, you know what, he's such a good guy, I'm going to help him out. And it's kind of a rogue process that it happens a lot of times when you get injured. It makes things to make the cells grow back faster. If you rip open your finger or do something like that. But in this case, cancer has hijacked it and it's doing it. It also makes pro-anogenic material. Anogenic means blood vessel. So basically, it makes more blood vessels come to an area. And cancer is very voracious. It likes sugar in particular. And so has to have a super highway to get there. If you're going to make something and you're going to make a lot of it, you have to have the train tracks. You have to have the infrastructure. So these mitochondria begin to make the infrastructure. And they start growing like crazy. So they actually hijack the immune system to make this process happen. Then they also release immunosuppressive molecules. So interleukin 10, they have interleukin 6, I know is another one that they make. And these basically make the immune system calm down, where the immune system can't see it. So there's ones that hype up the immune system and ones that calm it down. Then the immune checkpoints again, they take and change them. So they change that PD-1 that the macrophage makes into a PDL-1 so that it basically speeds up things. And then it binds to these and it acts like an off switch. So it makes anything that was working properly, it just comes in and shuts it down. So cancer is made to survive. And it thinks that's its job. So then it also hijacks all of the cytokines. Again, interleukin-6, tumor necrotic factor, all these things, it takes them and changes them over so they're in its favor. Because your body wants to make inflammation to heal things, but it doesn't want to make it for a long time. This has figured out how to take them, shut it all the way down where nobody can see it. So occurrences inside the cell. So now we're talking inside the cell. What happens? Well, when we get chronic inflammation, so that's created by our pro-tumor environment. So this is maybe you've had exposure to toxins, maybe your DNA is not working right. Our cells begin to break down. One of the very first things that happens is that DNA process in there. When it splits up and you're making a new cell, well, maybe it happens too fast, and now your repair DNA can't fix it. So now you start just throwing out this DNA that's wrong. That's one of the first things that happens with inflammation. The second thing that happens is mitochondrial dysfunction. So mitochondria are the powerhouses of your cell. They give all your power to your cell. They're also critical in making waste and getting rid of waste. And next month I'll be talking about mitochondria and how it functions throughout your body. But if anybody's been to my last 2 talks, I mentioned mitochondria quite a bit because it has a lot to do with basically your heart health. It has a lot to do with diabetes. And so once your mitochondria get to where they're not functioning right, whether that's because you already have diabetes, maybe you're putting in poor food, maybe you're exposed to chemicals, this is where it begins to not function right. Whenever you begin to get oxidative species, which is basically rust inside these mitochondria, everything else starts to go downhill really quick. Whenever you talk about mitochondria and making energy, mitochondria will go to the thing that makes energy the quickest. And usually that's sugars. Sugars will make energy quicker. Mitochondria function best on ketones, which means breakdown of fat and proteins is what they function best on. So I always describe it as a power plant. You have a power plant and it's able to run on coal or it's able to run on natural gas. When you run natural gas through that power plant, you have very little smoke, just moisture coming out. It's cleanable. It's easy to do. You start running coal through there, especially dirty coal. Now you got smoke all over the place. You got sulfuric acid. You got all these things going on. So the more sugar you run through that mitochondria, the worse off it is. The more clogged up that cell gets, the more that you're getting smoke inside the cell and debris inside the cell. So the cleaner fuel you run through it, the more clean the environment is inside your cell. When the cell gets dirty inside, as you're trying to divide it and you're trying to make new DNA, other stuff gets stuck on it and it just doesn't work out quite right. So that's why the mitochondrial health is so important. So then, the signals get messed up inside the cell. So when you start having all this inflammation and you start having the white blood cells dropping open and spilling the contents on them, it puts the cytokines out on top of your cell. So you come in, you rake off your skin on your arm, you get it abrased, and it sends all the inflammation there. You have all the cytokines. Well, sometimes those cytokines go inside of a cell, and it could be a good cell that's trying to do its job, but they start saying, hey, you're bad inside here, things swell up inside the cell, and functions don't work right. So inflammation is good until it's not. Immune suppression. So you have a cell that's going along just fine, whether it be a white blood cell, any other cell, and you also start getting these M2 characters in there, and they start putting out basically new blood vessels coming into that area. Well, when you do, you start getting too much fuel in the area. And cancer is really because things are moving too fast. You lost your accelerator is stuck to the floor and everything's moving too fast, or the brake doesn't work anymore. And so when you start getting too much fuel, too much sugar, too much blood vessel, too much flow in there, you start having problems. And it leads to angiogenesis and metastasis. So angiogenesis, again, is making a blood vessels. So now the cell has some DNA damage. You start putting some rust in the situation, getting smoke in there. Basically, the signals are broken. Now it's not being suppressed at all. You get new blood vessels to the area, and now it spreads and metastasizes. So that's the way that cancer is really created here. So one of the other things that happens inside of these cells, like the major thing that happens, yes, you can have the DNA that's wrong for mom and dad, but it's not functioning yet. Even though the accelerator's stuck, it's not having anything to fuel it, so the car can't go anywhere. Even if the accelerator's stuck, it's still tootling along. The brake isn't working. Well, as long as you're sitting still, the brake doesn't matter. But once you start throwing in carcinogens, radiation, infections, and then you throw in stress on top of it, now the car starts moving whether you want it to or not. And once it starts moving, an object in motion is hard to stop. So now you got the cancer heading in the wrong direction when you change those things. The top 20 cancers, and I'm not going to go through every one of them, but I want to hit on some of them. So there's I think 3 pages of this. But breast cancer, the cause for breast cancer, number one leading cause is obesity. So individuals that are fatter have a higher rate of it. Doesn't mean if you're skinny as can be, it doesn't mean that you're not going to get breast cancer. But breast cancer happens more in heavy people than thin people. People that tend to drink more alcohol tend to have more breast cancer. Individuals on hormone therapies tend to have more breast cancer. And then individuals that have certain genetics, the BRCA1, BRCA2, have more breast cancer. I will say, hormone therapy and BRCA1, BRCA2 go hand in hand. One of the things that turns that, and that's a brake. BRCA1, BRCA2 is the brake that stops you. When you put hormones in, it basically breaks that brake. So there's individuals out there that are getting hormone therapy, estrogen, they come up and say, oh, you'd feel so much better if you get estrogen, and they never check their BRCA gene. It should be that you have to check that BRCA gene before you give somebody estrogen. It should be a thing. So if you're thinking, hey, I'm going to get hormone replacement, do it. I'm also going to say this, I talked about last night, in my opinion, many individuals get too much hormone. I'm going to start with a guy. Take a guy, normal hormone levels, I think for a healthy male, in my opinion, is between 450 and 750. And really 450 and 650 depending on the age. And a normal young guy is going to be in that 550 to 750 range. If you get somebody who's super athletic and that, more androgens, he may be up to 1,000 or 900. Maybe. It's pretty rare. I've never seen a young guy there on his own. You take and you see what they're giving guys out here that are in their 50s, 60s, 70s as far as testosterone, and they have them up to 1,100, 1,200, 1,500, 1,800. Well, hormones are like a gas pedal. So if you're going to throw in hormones over top where they should be, you just hit the accelerator button on everybody. So, there's studies out there that say, hormones cause cancer, and then there's ones that say they don't. Well, if you give somebody hormones and you actually keep them where they need to be, it's not a big deal unless you have the BRCA gene, then you have problems. But if you don't have the BRCA gene, if they keep you in normal range, you're not hitting the accelerator, you're just cruising. You have it on cruise control, you're fine. But I almost know no endocrinologist, nobody that gives hormones that comes out and gives a person, hey, we're going to take you to the upper end of normal and we're going to keep you there. They always give you high because they pay for the dose, whether they give you 1 drop or they give you, half of the dose. And so they want to give you your money's worth. And so they think they're helping you out. And a lot of times they're leading you down this pathway. And if you're going to take some, you don't want to say, yeah, I feel a little better. You want to be like, yeah, I'm on top of the world. Same thing happens with women with estrogen. Menopause happens for a reason. So you come along and you're young, your cells are dividing perfect, and there's no broken parts in it, everything's going great. Well, you get to be 40, 50, 60, 70, and along the way mistakes were made. And so your body was designed to say, okay, we're going to start putting on some brakes here. We're going to lower down these hormones, because if we keep dividing at the same rate I was when I was 13, and now I got a bunch of junky cells, I'm going to make a bunch of junky cells really quick. So it slows them down on purpose. On guys, it says, hey, if you keep your testosterone at this much, we made this great prostate for you, but it's going to enlarge. You're going to have problems. So it says, I'm just going to slow it down. I'm going to make you a little more estrogenic, and I'm going to slow everything down, and there's a reason for it. Now, if you keep them in normal range, you're probably still okay. But you take them up to a 13-year-old, and you got all these junky cells, they're multiplying, that accelerator's been hit. So I'm not knocking hormone therapy, and there's people I send for hormone therapy. And there's times for it, and there's times not for it. But you should have it within reason. The last one is reproductive history. It's backwards from what you think on breast cancer. People who have never had a kid and have never breastfed are more likely to get breast cancer than people who've had kids and breastfed. So it's opposite there. And that has to do with hormones and that too. Lung cancer, primary reason, even to this day, is smoking. There are some studies, though, that say secondhand smoke is more likely to cause cancer than primary smokers. And the part of the explanation was told to me is primary smokers, when they inhale it, they actually inhale it harder and faster, and they get more stuff out. When you are taking in secondhand smoke, you're actually just passively taking it, and it tends to settle in your lungs more. So that's one of the reasons why. Radon, which is a gas that comes out of the ground. A lot of people have it in their house. It comes out up through the concrete floor. In places we've lived in the past, we had to have radon pumps to keep it out. It causes lung problems. Different other chemicals too in the air. Skipped asbestos, but in the air will cause problems. So a lot of fumes will do that to you. Even gas fumes. There's been a number of lawsuits pertaining to hydraulic fluid from the military, and especially pilots and people that have been exposed to it, mechanics there. But asbestos is still an issue. In this country, we've done a lot to cut it back, but there's times and places you have to use asbestos, especially in high temp situations where you're trying to separate a high temperature from something that has to stay cool. Asbestos is still there, so now we're trying to come up with better solutions, but it's out there. Colorectal cancer, number one reason for it, poor diet. When you're eating the junk out there, when I was just talking about all the chemicals, it's one of the things. For years, they've had processed meats as being one of the reasons for colorectal cancer. They've come back and said, well, maybe it's not as bad as they thought it was, but it's still one of the leading things in a poor diet. But colorectal cancer, poor diet. Inactivity. So the reason inactivity leads to colorectal cancer is 60% of your lymph nodes are around your gut. So all your lymph nodes, you have them in your armpits, you can feel them sometimes around your neck and your groin, but the vast majority are around your abdominal cavity, about 60%. And so the way that lymph fluid moves is when you move, you squish your muscles, you squish the lymph fluid, and it squeezes it out of an area. Well, if you're eating bad food and you get all that bad stuff in those lymph nodes that are filtering it out, if you're not squishing and moving those lymph nodes, basically it stays in there. And you end up with cancer there because it can't get the bad stuff out to get rid of more bad stuff, so the bad stuff starts staying in the colon. So activity is a big reason why. Obesity. So obesity plays multiple roles in colorectal cancer. Obesity, the fat cells tend to hold on to hormones. And what I say about hormones? Hormones are gas pedals. They accelerate it, so obesity holds on to that. Obesity also holds on to a lot of chemicals. Fat, a lot of your chemicals that we use nowadays are fat soluble. I said they come out of the petroleum industry. Petroleum is an oil. Fats are an oil. So your fat holds on to all the bad stuff that we're putting in our body. Then we got alcohol. The reason alcohol causes a lot of problems here, alcohol passes right through the lining. So if you take in alcohol, even in your mouth, it starts passing right into your bloodstream and things. And so alcohol tends to penetrate the sidewalls of intestine and stuff, and it changes the cells, especially the stomach. Tobacco again. And then irritable bowel syndrome. So irritable bowel syndrome is inflammation. You can say inflammation. If you have inflammation, remember the cancer cells like that and it breeds off of it. So that's why food sensitivities and then genetics. There's a syndrome called Lynch syndrome that is genetically related to colorectal cancer. Just because you have that gene doesn't mean you're going to get it. If you eat healthy, you avoid inactivity, you avoid obesity, you avoid those things, you can have all the genes wrong and you never turn them on. It's never able to do it because all your checkpoints are working except one. So we have the checkpoint of our accelerator, we have the checkpoint of our brake, we have the checkpoint of repair, then we have our checkpoint of our immune system. You have to break a number of those places before you get cancer, you know? So it's a matter of one thing doesn't cause it. It's this whole breakdown of things. And if you start throwing in poor diet, inactivity, obesity, alcohol, tobacco, and then you have food sensitivities and you're not paying attention, and you have that gene, you're going to get cancer. You know, you need 2 or 3 of those to start setting things off. Prostate cancer. Prostate grows with age. The other thing I probably should have put on here was lack of sex. So it's a true thing. So when guys say, hey, I need more sex, that's an issue there. It tends to be as you get older, you have less sex. The prostate is full of prostatic fluid, which is mostly what makes up an ejaculation. And so when it doesn't come out, it stays in there, it gets thicker. You get one bacteria in there growing, and now it swells up and gets larger. It makes inflammation in it. The accelerators hit because of the infection. You have the inflammation, which is slowing down all the stuff around it. And now, not only does it get enlarged, then you get an infection. You add hormone therapy to this. So now, we take the same individual, they're having other issues, we throw in testosterone. Now we just hit a double accelerator. So now we got an infection there, a little smoldering, nobody knows about it. You hit the gas pedal with testosterone, and we got problems there. There's some family history. I put a slash in genetics. Family history is genetics. The BRCA gene, the same one in females that we talked about in males, is a situation here. And it can cause some serious situation. And then obesity. Fluid doesn't exchange good in the prostate when you're heavy because you go set on it all the time. From occupational standpoint, there's a couple occupations that are really bad for prostate cancer. One is a truck driver, because they're constantly setting on that prostate. They're basically bumping on all day long, and it hits it. And farmers. Farmers set on a tractor, and they get hit all the time. And farmers, I'm also including ranchers who are sitting on a saddle and basically beating that all day long. Farmers, ranchers, and truck drivers are usually constipated because they can't go to the bathroom that often, so they hold it. So that feces gets hard in the rectum, and it literally, every time it's hit, it bounces up and hits that prostate. So it's just kind of like taking a hammer all day long and hitting it. So it gets inflamed and you have problems. I'm going to go ahead and jump down. These are all here. The point I want you to start to see is you see obesity, smoking, alcohol, inactivity. You start seeing things, infections. You start seeing those kind of things line up one after another after another. When we go through the top 20, you can start to see it. Smoking, radiation, diabetes, which is bad digestion again. The only difference is kidney disease has high blood pressure in it. So high blood pressure kind of messes up the kidneys and can make some interesting situations there where the high blood pressure is pumping too much blood into it. So now you just hit the accelerator for cancer there. So, the Hodgkin's lymphoma, non-Hodgkin's lymphoma. What I want you to notice there is that infections are significant in there. So when we have an infection, especially guys tend to get more stomach cancers. They tend to get more colorectal cancers and things. And it's because they get an infection. Well, I'm okay. A guy will be sick for 3 or 4 years before they ever go get help for it. A lady kind of knows her body a little better and says, okay, yeah, I'm not right. I'm going to get this fixed. And so, it's a situation where if you're not taking care of some things, you get problems in there. Ovarian cancer, again, age makes a difference. Genes make a difference. Obesity, and then hormone therapy makes a difference. All these still kind of the same things. I'm going to leave those there for you. Common cancer causes. It should be pretty evident now. After we just saw those, tobacco use is what they still say is number one. And I can remember when I was in China, back in, I think, 97, 2005 or so, they had billboards up. And the billboards were just like what we had back in the 50s and things. It was the Marlboro Man, of the Chinese Marlboro Man, and it says, smoke, it's invigorating, it makes you feel good. And it's the same thing we used to have in the commercials back in the day. It was like, hey, smoke, you'll feel better, it makes you have energy, you can get through your day. And they still had it. And I asked my translator, I said, wow, I can't believe they had a sign. She goes, why not? And she goes, it is invigorating. My father does so good when he smokes and everything. And I said, do you know it causes cancer? And she goes, what? I said, yeah, it's a major cancer cause. She goes, no, it's not. And I thought it was just interesting that there was that dichotomy between us. So, smoking, tobacco is still number one. Poor diet is most likely number two. Most inflammatory things in the United States is what we're putting in our mouth for food. A lot of it should be criminal, especially when you travel to other countries, other nations, especially Europe. We have, I don't know how many foods or how many things put in our food here that are not allowed in Europe. Even our GMO crops are not allowed in Europe. If they come out and test your field, it's a genetically modified field, they come and burn it down. And so it's an interesting thing that they do. They use very little pesticides. They do like a 10-year rotation on their crop field. So they may have spinach in here this year. They may have corn next year. They may have broccoli next year. And they say, well, if we get a few bugs that eat broccoli this year, As long as we don't put broccoli in it for the next 10 years, those bugs will come out next year and they will be dead the next year. So they have very little, like, bugs don't do anything. The herbicides, they plant their field when they're done, they harvest it, they let all the ducks, they let all the geese, they let all the cows, they let all the sheep, they let everything pick every seed out of that field. So they have very few seeds left over in that field. Then they plant the next year's crop, something different. So they don't need herbicides, they don't need pesticides, they're not using genetically modified foods. We do. Part of the problems with tariffs right now that we're experiencing with Europe, whenever they said, hey, we want you to buy our products, our cows, our pigs, our grains, and all that kind of stuff. We have plenty, we want you to buy them. And Europe's like, no, we don't want to get sick. We don't want your food. And we now have administrations say, no, you have to buy our stuff. Most likely they will buy our stuff and they'll pass it off to a third world country is what they'll do. They'll figure out a way around it, but I don't think they'll feed it to their citizens. And we have RFK trying to come in and say, hey, we need to clean up our system, but there's this whole money exchange there. So right now we're the sickest nation in the country for as wealthy as we are, and we're paying more money for health and not getting the benefits from it. Number 3, lack of activity. If you do not move, you get heavier. If you do not move, you get more inflammation. If you do not move, your lymph builds up and you don't clean out. Your lymph is your cleaning station, and I think in August, somewhere like that, I'll do a talk on lymph, but it's the one that cleans out the debris. And if you're not moving, you're not cleaning out the debris, so you have to move. Obesity. Obesity leads to chronic inflammation. So fat cells, when they get so big, they actually put out chemicals that start making you swell and get bigger and bigger. So it's kind of like this cascade of events that happens. And when you get inflammation and it goes the wrong way, you're going to have cancer. Also, the heavier you are, the more estrogen you have trapped in the fat. Fat is estrogenic, and estrogen is the gas pedal. So it makes a big, big difference. Chronic infections. Viruses, bacteria, fungus, those are big ones, and they cause a lot of problems. You may be seeing on the social media right now, Facebook and all that stuff, they're talking about parasites. And this is kind of a dichotomy I talked about last night. They're talking about ivermectin, talked about bendazole, those kind of things to kill out parasites and that. There's a dichotomy between the medical world and the functional medicine world. And the dichotomy here is that the term that the functional world uses for parasite is anything that eats off you, survives off you. So they see viruses as parasites, they see fungus as parasites, and they see worms and parasites as parasites. The medical world does not consider anything a parasite other than the worms that eat off you. So when you see the functional world talking about these parasites, and now somebody from the medical world, you go to them and say, well, you know, I think I have a parasite. They're like, no, we've checked your stool. You do not have a parasite. Well, they're not checking you for fungus. They're not checking you for viruses and that kind of stuff. That's the dichotomy. The dichotomy happens with a lot of other things in the verbiage. For a couple decades now, functional people have talked about leaky gut. And you go to your gastroenterologist and you say, I was diagnosed with leaky gut. There's no such thing as leaky gut. Are you kidding me? You're wrong. Now, it's increased permeability. So they come up with a name for it that's different, and so they can make a medicine for it and take care of it. It's kind of interesting. In the chiropractic world, the term that's always messed up is called subluxation. A subluxation in the chiropractic world means that the bone is just shifted and not moving quite like it should be. In the medical world, a subluxation is when a bone is ripped out of its joint. So if you have your shoulder dislocated and it's hanging down, or your toe's been broken and moved over, that's a subluxation. So if you go to your medical doctor and say, oh, I went to my chiropractor and I had a subluxation and he fixed it and I feel great now. He'd go like, no, he didn't. You know, that's ridiculous. It's actually if they come together and would use the same language, and I don't blame the medical doctors any more than I blame the functional medicine people. Functional medicine person is to say, you have increased permeability. There wouldn't be a dichotomy. The medical doctors would say, okay, I understand what leaky gut is. I understand. But they're so opposite in the spectrum, they won't even talk to each other. I'm in between. The medical world hates me because I'm too holistic. The holistic world hates me because I'm too medical. So at least I see both of them and try to communicate. Food sensitivities. This is a big one. So food sensitivities, when you have a food that you're sensitive to, let me explain food sensitivities. So you may go somewhere and you talk to a medical doctor again and say, I have a food sensitivity. He'll say, nope, I'm looking at it. You had a food allergy test done. You don't have any sensitivities. There's a big difference between a food allergy and a food sensitivity. If you have a food allergy and you eat it, your throat swells up, you get hives on you, you may not make it actually, like peanut butter type things. That is an IgE. That's an antibody that makes you overreact to things. On a food sensitivity, it is called an IgG. That's the flag that basically your B cell carries, is an IgG antibody. It causes you to have inflammation. It causes you to swell. It's almost like you have a flu inside you, is what it is. So some people get a stuffed up nose when they have the food that they're sensitive to. Other people will have constipation, gut pain. Some people swell because their lymph nodes swell up. Some people have diarrhea. So when you have a food sensitivity and you're not paying attention to it, it causes cancer in that it causes inflammation in you. So a lot of times you get these food sensitivities cleaned up. Sometimes you can put the food back in, sometimes you can't. But basically, it causes tumor suppression, or just the opposite. It causes anti-tumor suppression, so it causes your immune system to create more cancers. Alcohol consumption. It's toxic for the most part. Your body can clean it up. It actually uses some components from alcohol in a beneficial way. But it's one thing, if you go out and take 1 aspirin a day, you're fine. If you go out and take 6 aspirin every day, you got a problem. Alcohol is the same exact way. It's kind of like with anything you take. If, a steak is good for you, you go out and eat 6 steaks a day, you have a problem. Alcohol is the exact same way. Alcohol tends to be more addictive than a steak. Radiation exposure. Again, we talked about sun. Go out and get your callus, get used to the sun. Sun is actually very beneficial in your immune system, creating vitamin D, which takes down cancer. So go out and get sun, but you don't want too much of it. You don't want too many x-rays. You don't want to take too many flights. All these things lead up to that. And our government, like I said, with DARPA and some of the other radar things that we're using, causes a problem. I used to work in the city of Columbia, Missouri, and I worked for the Power and Light Department, and they had a radar system, like one of the big white balls on the roof. And there was always a door there that says, hey, turn off the radar before going on the roof. But somewhere along the way, when it would get hot, because it was on the 5th floor or 3rd floor of the building or something, they would go open up that door. Well, it really didn't matter much because there was kind of a little hallway. But the interesting thing was, there was a guy that had a door right inside that hallway, and from him, he could see the radar right from his desk. Anyway, he ended up with cancer and passed away. And so, most likely, he got exposure from that. I always thought it's funny though, the parking garage was right next door, and it was right even with the parking garage. So everybody that ever parked there at least got a pretty good hefty dose of radiation every time. Age makes a difference in cancer. As I said, when you start out and you're younger, your cells have been dividing. They're doing the best they can, but over time, a cell gets messed up, and you're still trying to do the best you can to make it right, but it's just not the same. That's why we get discoloration in our skin as we get older. That's why we get bumps. That's why we get things that don't quite work right, is because we age. If you put the accelerator down when you're aging, it's going to happen faster. So chemical exposure, I was a young guy out riding the tractor with Roundup behind me, and I'd turn my tractor around and run right through it again as the breeze was going. I think, boy, that tastes good. It'd get on your lips and you'd be like, that tastes good. Never thought anything about it. In fact, as they said, it was harmless. Now we found out that's probably why I have food sensitivities, because of that. Asbestos, smoking, all those things. Hormonal factors, imbalances. So, some people are born with hormonal factors. They have too much estrogen, too much testosterone, and nowadays they treat those situations. But many of the hormone factors is self-inflicted. We're going out and getting hormone treatments and stuff that are over the top, like I mentioned. Chronic inflammation. So there's times when we get things that are going on in our bodies that we ignore. We don't take care of it. So you might get acid reflux, and it's constantly there. Instead of getting it taken care of, basically it's constantly going. You get esophageal cancer, you get stomach cancer, throat cancer, that kind of stuff. When it's actually pretty easy to take care of if it's done right. Chronic infections. Almost any man who's been in the military for any time period at all has toenails that are about a half-inch thick and as yellow as can be. And most everybody says, not a big deal. Not a big deal. That toenail is growing out of the cuticle there. When it's back inside the cuticle, that toenail looks kind of like caulking. If you actually take somebody's toe and you cut off the toe and you cut back the cuticle, it's soft in there. It's actually not hard. And actually your cuticle is kind of like a squeegee. So as it starts to come out, your cuticle makes it nice and pretty smooth toenail. Well, when it gets all the way back inside there and it gets that soft material, guess what? That soft material has a whole bunch of blood vessels right there by it. So once you've had that toe fungus for, 20, 30 years, 40 years, 70 years for some people, it's now in your bloodstream. And it's constantly having to fight that off. And so little infections like that are a big deal. I have people that come in and they have a cut on their arm. I had a guy come in, his pinky's almost half cut off a farmer, cut it on barbed wire fence, and it's infected because, I get that stuff all the time, it'll heal up. And it will, probably. But he's constantly making that little chronic inflammation, and he'll probably have some kind of cancer someday from it, And then genetic and family history, common cause for it, you inherit the genes. Mom and dad, one of them gave you a bad gene or both of them gave you a bad gene. But remember, that's only one aspect of it. The genes don't set the pace for you. The genes basically are there, and you can turn them on and off by what you're doing with all the environmental stuff. So it's important to know. So this is common sense now. What do you do to avoid cancer? Don't smoke, don't vape, don't be around people who smoke and vape. Treat chronic infections. Clean them up. So, if you're dealing with something, figure it out, get it cleaned up. Clean up your diet. Avoid excess hormones. If you're going to do hormone therapy, avoid it. Avoid the excesses. Inactive, sedentary lifestyle, get moving. You need to get moving. And all my best friends have been over 80. All the time. I always say, you gotta be 80 to be my friend. I've said it all the time. And I always say, when you get to be 93, we probably need to break up because most of my friends die at 94. And they die of a good life. They basically say, I'm just tired, I'm done. I said, what can I do for you? No, I'm just done. And they go to bed and they don't wake up. The catch is, all of those people have been active. We go hunting, we go fishing, we go hiking. They're working on a project. Very few of them are sitting down watching TV unless it's one show one time a day and they're up moving the rest of the time, or they're taking a nap or doing that. They have an active lifestyle. If you're not going to keep moving, you're dying. Anything that doesn't move in your day, your body thinks it's dead. So if you take your finger, put a cast on it where it can't move, and you let it sit there for a month, 2 months, 3 months, take cast off, it's smaller. Let it sit there for a year, and your finger, even the bones in it, will start to deteriorate. The perfect example of this is somebody has a stroke, and all of a sudden their hand pulls up, and this hand over here is working fine, looks just like it did before. This hand's half the size and smaller within a year. If you don't move it, you lose it. And I even tell people in the nursing home and things, I say, okay, the best thing you can do is move every joint in your body every day. If I take and I move my fingers, I move my hands, I move my wrists, move my elbows, move my neck, move my toes, move everything, basically your body just says, didn't know that finger was alive. I better send some nutrients to it. I better make sure everything's okay there. I better check for cancer. That's good. If you're only using the top of your lungs and you never breathe all the way in and all the way out, you're not using the bottom of your lungs. Your body says, don't need them. Let's just turn off the nutrients. Let's turn off everything. Stop checking on it, guys. No need to waste that energy. Well, then you get cancer there. So every part of your body needs to move every day. Unnecessary exposure to environmental carcinogens. So me driving the tractor, I should have had a mask on. I should have came in, showered off. I should have cleaned off. A lot of us are using household cleaners and wiping down. We don't go wash our hands afterwards. We're using spray paints. We're not putting a mask on. Little bitty things make a big difference. I'm guilty of every single one of the things I just mentioned, by the way, 100 times over. I had a gentleman here last night that does spray foam for a living. And one of the things I mentioned, I said, boy, you open up that barrel to put in your tap into it. I said, it kind of smells good, doesn't it? And he's like, yeah. I said, but you don't wear a mask when you do it. So anyway, he's back there shaking his head. Yeah, we probably ought to wear a mask. So excessive alcohol consumption. If you're needing that 2-3 drinks a night to calm down, you probably need a little help. You probably need somebody to help work with you. That one drink once in a while, that one drink a night, probably the limit. Sun exposure, not too bad if you're building up over time. Going to the tanning beds, I'm not anti-tanning bed. I'm anti-15-20 minutes in the tanning bed. If you have a seasonal affect disorder and you get to January, February in Wyoming and you're taking your vitamin D and now you can't hardly function, I want you to go up here and get a membership to the tanning bed. I want you to go twice a week for 5 minutes. Not enough where you're turning red, not enough where you're burning. I want you to do it. People would slaughter me for saying that. Now, if you have already gotten the exposures to it, or you already have a skin cancer, it's out the book for you. You can't do it. You know, it's one of the things. It's kind of like saying if you have stomach cancer, well, I'm just going to go have me a beer and I'm going to drink alcohol. No, it tells it. It's the same way. I wouldn't tell you. I would be telling you right now, nope, cut out the alcohol 100%. If you had skin cancer, cut out the tanning beds, watch the sun, cover up, that kind of stuff. But other than that, that little exposure is going to give you the callus on your skin and do it. You're pretty pale. I wouldn't put you out in the sun for 15 minutes. I would let you go out for 2 minutes, 3 minutes, 4 minutes, 5 minutes, and then we get more sun. But that's the way it is. We want to reduce our inflammation. Avoid those bad foods. There's foods that I think almost every individual will come out and say, I know when I eat it, I swell up. And there's just something out there. Mine's tomatoes. I swell up great big. Gluten, dairy. Do it. Reduce your stress. And there's people, well, I don't know how to reduce my stress. I got to do this, this, and this, and this, and this. There's things that probably a lot of my patients come in, especially when I see them sympathetic dominant. There's two parts of your nervous system. You have sympathetics, which are fight or flight. You have parasympathetics, which are rest, digest, and heal. And when you want to engage sympathetics, I can tell you the easiest way to do it is stimulate anything from your rib cage up. Breathe up here, and I can actually make myself nervous if I keep doing it. If I come in and I activate from my ribs down, deep breathing, I could probably lay down on the floor after about 10 breaths and go to sleep here right now. It's that easy. If you're having stress, if you go out and walk the sidewalks and you're not thinking about what was worrying about, you look down at the grass on the ground, you look at the trees, our subconscious still thinks we're hunter-gatherers. And it says, wow, if you're actually taking the time to look at the grass growing out of the sidewalk and you're looking at the trees, you must be foraging. So you must not be worried about the bad guy. You must not be worried about the lion, because otherwise you'd be looking around worried about it. And so literally taking a 5-minute walk when you're worried and looking down at the grass and thinking, look at that pretty grass, look at that bug there. Your brain says, oh, you're foraging, we're good. And it actually changes that drastically. And most people don't do that. And most people don't belly breathe. Maintain sleep hygiene. So there are nowadays everything against sleep hygiene. Electronics are probably number one. When you are looking at electronic, unbeknownst to you, that electronic is flashing like that. If I pick up a book and I go to read it before I go to bed, that book is not blinking. It's solid state. So my brain reads it and sees it, and I'm only seeing one picture at a time. Now, if I took that book and I took it in front of you and I grabbed a hold of it and now I start running through the pages, flipping it like that, and I'm telling you to read it, you'd be a nervous wreck and you wouldn't sleep. Well, you have no problem looking at your electronics. The screen is blinking right now. Blinking 1,000 miles an hour, more than that. I think it's 1.5 thousand, so 1,500 times it's blinking. If you sit here and look at the screen compared to looking at your paper, if you look at your paper, you're going to be much more relaxed. So that's a sleep hygiene thing that comes in. If you go and drink before you go to bed, it knocks you out. About 3 o'clock in the morning, your blood sugar spikes. Boom, goes up. And when it spikes, it says, oh, you got too much blood sugar. You need to move around. You wake up and you think, I'm tossing and turning to bed about 3 o'clock in the morning. I don't know what's doing. I said, what time did you have wine last night? Well, right before bed. And I said, that's why. That's why your blood sugar jumped up. Sleep hygiene is important. Common medical cancer treatments. So surgery. They want to cut things out again. There's actually times that it's extremely beneficial. Some skin cancers, you're better off getting them out. I will tell you this. Skin cancer is probably the number one preventable cancer from metastasizing and spreading. A lot of people, though, will have a place on them. They don't go get it checked out. And usually with skin cancers, what you see is the tip of the iceberg. And I know that my job for a while in the hospital was to get these tumors in, put them in a block of wax, and cut them thinner than paper thin. And I would look through them. And the doctor would come down, the pathologist would come down and say, okay, we have clean margins at slide 105, and to 325, we have clean margins again. The main metastasis is at number 205 and this. And the doctor would look at the slides I suggested, yep, you got it right, and we have clean margins. Once in a while, we come in and say, Okay, slide 1 has no clean margins. Slide 325 has no clean margins. Tumors evident on slide 205. They have to go back in and cut out more to get it out. And so what you see is the tip of the iceberg. A lot of them around the nose, bridge of the nose, and right here around the lacrimal duct and things are much bigger than you think. We've gotten sun there that's beamed in. The skin is thin there. It goes deep in, and we have it. So if you ever get anything anywhere up here, and it just has a little roughness to it, it's different, don't wait too long. You know, that's something you want to get it checked out. Guys tend not to worry things on their back because they don't see it. They'll get stuff on their legs and they say, oh yeah, that. And I say, well, you have anything else? Well, my wife's been picking on me about the one on my back. Well, how long have you been? Oh, that one's been about 10 years. Why haven't you done anything? Well, I just can't see it. So if your wife says you got something on your back, go get it checked out. And that's a pretty cheap lifesaver. I mean, once it metastasized, most of your skin cancers are pretty nasty at that point. So don't wait long on it. Chemotherapy. This is chemicals. Chemicals to kill it. It's come a long way. Chemotherapy back 30, 40, 50 years ago was straight up poison. Straight up poison. And it was decide whether you were going to kill the cancer first or you first. And they were hoping that the cancer was so hungry and had such an accelerator to it, had such blood vessels to it, that it would get more of a dose than the rest of your body. They've gotten much better at using targeted chemotherapy than what they used to be. But I will say this. If you're going to have chemotherapy done, you ought to make sure that they do a genetic test on you to see if that chemotherapy, if you can process it. There's a number of genes that regulate whether you can do this or not. When I do individuals genetic testing here, when we do it, I go through and there's a number of times I will say this chemotherapy wouldn't be one for you, this one wouldn't be one for you, this one wouldn't be one for you, and it shows up. I believe it's Dr. Reed over here at the Cancer Center. He's pretty good about running this. I've had a number of patients that come in and see me, and I'm looking through the information that he's provided, and he runs that test for people. So it's good if you have to have chemotherapy, you may say, hey, can you do genetic testing to see if this is the proper one for me? And a good doctor will say, well, yes, we can run it. You know, radiation therapy. I was highly, highly opposed to radiation therapy. In my opinion, I thought, well, you're just coming in and burning up everything. And I've seen that the case, especially sometimes with different brain tumors, with different prostate cancers, things like that. They've gotten much better at it. Now they use seeds a lot of times. They'll put a seed in that's radioactive. It kills just the things around it. But one of the patients I did a consult on just a while back, he comes in and says, hey, they want to use this drug on me and they want to do radiation therapy. What are your thoughts? I said, well, I don't like radiation therapy, but give me a couple days to follow up my research. I came back in and I said, okay, the reason you want radiation therapy is the particular cancer you have has put up a barrier around it that basically your immune system cannot see it. It doesn't know it exists. And they have found with your particular cancer, if they give it a low dose radiation, it disrupts the barrier around it, kind of breaks down, melts the walls around it. Now when they give you immunotherapy, it can find it, it can kill it and get rid of it. So there are certain times in certain individuals that radiation is good. If they come in and they say, well, we don't know what cancer you have or where it is, we're just going to radiate you, I think there's a whole lot more questions that need to be asked. In the case of this gentleman, they had a plan, it was legit, and his success rate, if he didn't do the radiation, success rate was almost 0. I think it was 1 or 2%. If they used the radiation in his case, success rate was almost 100%. So when you play out those statistics and you play out the outcomes, my thought was, if you were my father and my brother, me, I would do it in your case. And I went in opposed to it. So there is times for radiation. Immunotherapy. Immunotherapy is basically an injection of the flags. So they've made these antibodies that basically go and stick on the antigen of cancer. So they've said, okay, you have this specific cancer. We have an immunotherapy for it. You come in, they inject you with immunotherapy. It floats around in your body. It sticks to the cancer, and your immune system goes, whoo, there you are, and comes in and kills it. And that's how immunotherapy works. The catch with many immunotherapies is that you have to have a strong enough immune system to make it work. Because if your immune system's down, it's hard to make it work. There is a doctor out there right now, and I didn't put his name up here, Dr. Patrick Soon, S-O-O-N. The guy's a billionaire. He's done a lot of interesting things in his life, but he has a new immunotherapy which basically makes your cytotoxic cells more aware, makes them work better, and makes your natural killer cells work better. Right now, his medication is approved for pancreatic cancer, and he's taken people from months of living with pancreatic cancer out to 4 or 5 years, and some of them may be going farther now. So he's actually added a lot of time to their world. And bladder cancer, he's having really good success with bladder cancer. They haven't approved his formulas on other things yet. So there's individuals getting it off-label and trying it out, but there's not the research to back it up. But Dr. Patrick Soon is doing some interesting things. I think if I would get cancer, it'd probably be one of the places I would try to find out and research it more of how to get there. I don't know enough about that, but that's been the last few months that I've learned about that. Targeted drug therapies. So some cancers are processing chemicals too fast because remember they're revved up and they process it too fast. And so when you put certain chemicals in the body, that chemical works on that cancer to kill it. So it's actually a type of chemotherapy, but it's very targeted to just a specific thing in there. Hormone therapy. So if you come in and you have prostate cancer, they come in and they try to lower your testosterone and they give you estrogen because it stops basically the prostate from growing. It actually makes the prostate shrink. They did this for my grandfather, and his prostate shrank and his cancer was under control. But it was kind of interesting. My grandfather was always kind of a little bit of a rough guy, and he was put on estrogen, and about a year or so in, you'd talk about something halfway sappy. You know, you mentioned grandma, or because grandma passed away, or you talk about growing up or something. All of a sudden, grandpa started crying. He said, "Damn it, I don't know why I'm crying," you know. And I said, "Well, it's just the estrogen." "Well, I don't like it." So it was kind of an interesting thing. But hormone therapy has its place in cancer treatments too, because if this hormone was the gas pedal, you can put another hormone in and put on the brakes on it. So it's kind of one of those interesting ones. Stem cell transplants. Stem cell transplants, especially marrow, bone marrow. Nowadays, it used to be if you were going to get a bone marrow transplant, you had to go find a match. And that match was going to have to be pretty dang close. And I did that for a while in laboratory, matching up people, working in a transplant lab. And it's not an easy thing. And a lot of times you think, well, I'll get a relative. No, and some people die without having it. Nowadays, they are able to go in and use pheresis and pull out your own stem cells. And they're actually getting to the point now that they can see your stem cells and see if they're good ones or bad ones. When they go through there, they now use photo light to say, okay, this one's the right size of what it should be, and it measures out all the ones and collects those. And it says, hey, this one is this color, so all the ones that are that size and this color we're going to keep, and they re-inject them back into you. And so it's kind of a nice way of doing it. You get your own back, and you get your healthy ones back. So, but usually to get a bone marrow transplant, they're killing out your bone marrow that you have now. So they use radiation and chemotherapy. But there's times when you have to do that. Your bones are all full of cancer, and it's the wrong kind of cancer. If you come in and kill it, you're going to die. So they come in and kill it and put back in new, fresh stem cells. So there's a place for it. Now, popular alternative care cancer treatments. This is probably why everybody came. And you may or may not like me when we're done. I'm going to give you the goods and the bads of them. Ivermectin. So ivermectin is pretty much for cancer treatments in preclinical, which means everybody out there is trying it and trying to figure it out and seeing whether it works. Ivermectin in particular, the way it typically works is it slows down fast-moving cells. So it's kind of a break type process is what it does. Ivermectin, there's no definitive clinical trials or major health organizations out there supporting it as a cancer treatment. So everything out there is kind of anecdotal, people saying yes, it worked. And I will say, probably many times when ivermectin works, there may have even been a misdiagnosis. So the diagnosis was, yes, you have this cancer. But as we saw a while ago, a lot of cancers are caused from chronic inflammation, chronic infections. So the truth is, what you did is you came in and treated the infection, whether it be a viral infection, a parasitic infection, a fungal infection. You treat that infection, and now the cancer is sitting there, your body says, oh, I can now see you, and your body comes in and does what it's supposed to do. So it's more of a supportive mechanism. It also does slow down fast cells. So it slowed down the cancer, didn't kill it. It killed the infection. Now your immune system will say, okay, I don't have to come over and fight this infection every day. I don't have to fight this. I can come over here now and this cancer is going slow enough I can fight it off. So that's how, in my opinion, ivermectin really works for cancer. It's not necessarily the cancer killer. It just makes the environment right to let you do it. Fenbendazole. Fenbendazole actually has no human trials. It's actually an animal drug more so than ivermectin. Let me go back to ivermectin for a second. Ivermectin, we give out about 300 million doses every year as a U.S. government. We give it out to South America, we give it out to Africa, and the gentleman who invented it got the Nobel Peace Prize. COVID comes along, somebody says, hey, let's try it out on COVID, and everything goes crazy and says, oh my God, you're trying to kill people and everything else. How bad a person are you trying to use this? Well, the truth is, if it's that bad for you, how bad of a country are we that we have been spending billions of dollars over the last decades giving it out to everybody in Africa and South America? So that's another dichotomy. Is it good or bad? Truth is, it's probably somewhere in between. So I've had patients that were actually, I would call them brilliant patients, professors, that decided ivermectin was good, and so they go out and they take 12 milligrams a day, every day. And what I saw clinically was after 9 months, a year, they started getting Parkinson's. And after a while, they couldn't even tell you what they did or what they had for breakfast. So it slows down things. As you get older, your brain slows down a little bit. Your cells don't divide as well. And so if you're taking too much ivermectin, you're going to have a problem. So now the difference is they were taking it every day. When we go to Africa, they come into the village once a month. You get your capsule, your tablet, and you go back away until next month when you come in. When you treat your horses, when you treat your cows, when you treat everything at your house, you're not treating your cow every day with ivermectin. It's a dosing issue. So ivermectin is good. Now, in cancer and things like that, I could see where you would come in and you give a dose 2-3 months, something like that. I'm not recommending the dose. I'm just saying I could see where that could happen. And you're not going to have the neurological issues. You're not going to have the dosing issues, but yet you could slow down the things. I think if you're going to go take it for a long period of time, you're setting yourself up for problems. Now I'm going to go on to fenbendazole. By the way, I've had horrible time saying that, so it's worked out perfect tonight. It's usually used on animals. So you can't say that with ivermectin. Ivermectin, you can say it's been used on humans and animals. Fenbendazole, it's mainly used on animals up until very, very, very recently. It works in cells that are multiplying rather fast by making the tubules. And tubules are kind of what pulls apart the two cells. So if you have one cell and it divides into two, the tubules do that work. It makes those not work well. So we're not sure how in long-term dosing or anything that affects your own cells. We do know it slows down cell replication. We do know that cancer cells replicate faster. So in the overall scheme of things, it's putting on the brakes. The problem is you're putting the brakes on bad cells and good cells. But if your cancer cell is dividing 10 every hour and your good cell is only dividing 1 time every hour, it's going to have a greater effect on your cancer cells than it is on your good cells. And if you slow down your cancer cells, maybe you give your body a chance to fight it off. The problem is you're hurting yourself in the meantime. So I would basically say it's a little like chemotherapy. Which one of you is going to die first is the way it works out. Methylene blue. This is great big out there on all Facebook, and I'm going to say this right off the bat. Methylene blue is either really good for you or really bad for you. Your genetics play one of the biggest roles. I've had a number of people coming in here that are having all kinds of emotional issues, energy issues. They're tanked out. And when I look at their medication list, they're taking methylene blue. I said, hey, you started this methylene blue. Did you start out feeling really good? Well, I took it because I was a little tired, and it gave me a ton of energy for, I said, 3 weeks. And they're like, yeah. Well, their genetics actually say they can't break it down. So it's become toxic in their body. And we see that in genetics. So methylene blue can be really good for people or really bad for people as far as taking it orally. Now, for cancer, no studies again for cancer for methylene blue. Methylene blue probably doesn't necessarily help out with cancer in the traditional way, and there's no studies out there that says it does. But when you look online that people say methylene blue basically is perfect for cancer, it works for cancer, there's a ton of studies out there that methylene blue works for cancer. And that's a great sales ploy, is what it is. Methylene blue, when you use it with light therapy on certain cancers, is 100% effective. The way it works, you stain that cancer with methylene blue, you shine a light wave in it, and it basically vibrates it apart, breaks it apart. So methylene blue is used for cancer. It is a cancer treatment. It works extremely well on certain cancers, not as a standalone treatment, as actually a light dynamic photodynamic therapy. So it's a little deceiving. And a lot of people are selling methylene blue right now. And I'll tell you the other thing with methylene blue. Methylene blue cuts back your own nitric oxide levels. So if you're an older person, your nitric oxide levels are already low. You're not getting oxygen into your brain. You're not getting into your genitals. You're not getting into your eyes. And you take methylene blue, basically you're shutting down that nitric oxide in those areas. So it's probably not a good treatment in general, except for certain people who need it for certain processes that show up on genetics. Gene therapy. This is where you take and basically you introduce a new gene. A lot like mRNA that we did with the vaccine. The guy who invented mRNA tried for decades to get a lot of studies done. My son has a juvenile retinoschisis, which is it's a hereditary eye disease, which he can go blind in his teenage years. There are studies they've done on mice now with gene therapy. They give them the new perfect genes. They all of a sudden have perfect sight, and there's no problems. They've been able to do it now about 15 years. No, more than that, probably 20 years now. And they won't allow it to be tried on humans because it's too dangerous. It's too dangerous. Will not allow it. They will not allow it. So people go to Mexico, they go to other countries to get gene therapy because we won't allow it in the United States. We get a mRNA vaccine. Same thing, it's gene therapy. That's what an mRNA vaccine is, gene therapy. And also now they make it mandatory and you have to have it. They still won't let the gene therapy happen for my son to correct his eyes, or my father-in-law who's all the way legally blind. It could fix his eyes. They won't allow it. But yet instead they do it the other way. So it's kind of confusing to me. So gene therapy is debatable, but for certain cancers that are actually a genetic problem, this is a way to go. And sometimes it's worth going to another country. The problem is you don't know whether it's a good doctor or a bad doctor. On the other hand, in the United States, you don't know whether you're getting a good doctor or a bad doctor either. So it's the same way. Ozone therapy. Ozone is 3 oxygen molecules. So oxygen is 2 molecules put together. That's what you breathe in. That's what we use to survive on. Ozone is 3. Ozone tends to kill out bad cells. They get rusted. It actually comes in and rusts them and they die. A lot of times on our good healthy cells, they take ozone and they break off the oxygen, and so 2 ozone things will become 3 oxygen molecules. Bad guys are so voracious, they come in and go swallow it in, and it makes them rust inside and they die. So ozone has its place. Usually it has to be IV done. There's also, you can get too much of it, so there's situations where it's a problem. There's limited clinical evidence of this, but I will tell you this, I have had patients who have used ozone in conjunction with other things and benefited greatly. Individuals that have had major infections that they just could not get over, it helped them out. So it's something to look into. Vitamin C, high dose vitamin C. So vitamin C is kind of interesting. Vitamin C in general, you get people in that say, hey, I'm going to take vitamin C so I don't get cancer. Vitamin C tends to be acidic, especially if you're taking in ascorbic acid, which is the form that most people get. Cancers tend to like an acidic type environment because it causes more inflammation, and vitamin C kind of is prone to that. Now, vitamin C, when it's done intravenously, when they give it to you in higher doses then, can come in and actually help with cancers. There's some trials out there that says, hey, it can work, but nothing out there has ever said it works alone. It basically changes the environment so that your body can see it better and do it. So it's not, I'm going to go take vitamin C and wait for the best for my cancer. You need to put several things together with it. Here we go. I knew it was coming. I had it in my playbook. So the medical world will say your blood does not change much. It stays between 6.35 and 7.35 pH. And so the doctor says, these quacks, they're telling you to change your pH, and they think it's going to make a difference in cancer. Well, there were studies done a long time ago, and they said, yes, pH makes a difference. People that are acidic tend to get more cancers. People that are alkaline don't tend to get cancer. In fact, they went as far as to say people that are alkaline don't get cancer, is what they said. Now, the medical world says that's an impossibility because we've ran all the tests and your pH in your blood doesn't change. I say, okay, did you check their urine? Because your body will do everything it can to keep your pH in your blood the same. For instance, if you take somebody and you take them and you see how much oxygen and how much carbon dioxide they have, and you have this level, you give them something very acidic. And let's say you do their urine too. You do their urine's neutral. Up here, equal oxygen and carbon dioxide. You give them a real acidic drink, go give them a Mountain Dew or something like that. And you wait a little while, you come back up and you test their air. It's going to have a higher rate of CO2 in it. Because CO2 is acidic. So your blood, as it goes through your lungs, is trying to push out the acid like crazy. As it goes through your kidneys, it pushes out the acid like crazy. So you go from a 7 pH in your urine to a 5 pH. When you go and work out, if you didn't ever have acid build up in your body, if you go and work out and your muscles are sore and you go to the medical doctor and you say, man, I worked out last night really hard, or I raked the garden, I cut firewood, and I'm hurting. He said, yeah, that's just lactic acid buildup. Well, hold on, doc. You said I couldn't change the acid in my body. Well, you can't. So, you can change the acid in your body. You don't change the acid in your blood. And moving things towards a neutral or an alkaline situation has been shown to make a difference in cancer. You know, it's all debatable, but it makes a difference. So, alkaline diets have made a difference. I have a dear friend who had colon cancer, was not expected to necessarily make it, changed up her diet to an alkaline diet, and has now been cancer-free for 15 years, I believe, and doing wonderful. She's another doctor, does wonderful. So, alkalizing diet, keeping out the real acidic foods may make a difference in that little microenvironment where the cancer is happening. Nicotine. So, nicotine is one of those ones that lately has had a lot of precedent online and everything. Nicotine is very interesting. There are no studies done in the human body to see how it kills out viruses, kills out cancer. So everybody's like, take the nicotine patch, do this, do that. It'll help out with cancers, it'll help out with that. All those studies were done in test tubes. I, for a short time period, was raising viruses in a laboratory, and I'm going to tell you this. In a test tube and a petri dish, the hardest thing I've ever tried to raise in my life is viruses. If the wrong light hits it, they die. If the temperature changes for half a second, they die. If you happen to change humidity in the room, they die. And so they're extremely, extremely hard to keep alive. That's why they like to stay inside of a cell, because your body keeps that cell inside pretty neutral. So when they say, oh, nicotine kills viruses, what they did is they took a plate of viruses and they dropped nicotine on it. I could drop anything on it. I could drop carrot juice on it. I could drop anything on it, and most likely you're going to kill that virus. So the fact that they're using that to sell millions of dollars of patches and drops and everything is a pretty big deal. Now, nicotine tends to accelerate your immune system a little bit. It makes it so people that tend to do a lot of nicotine tend to get autoimmune disease because it bumps it up. So from that aspect, nicotine might help out a little bit as far as lighting up your immune system. So I still wouldn't make it as a standalone. I'm going to just take nicotine and see if I get rid of my cancer. Nicotine also is highly addictive. It can cause heart problems. It can cause a whole bunch of other issues. There's one time out there when I think nicotine is of a benefit. I do genetics on people, and some people have a gene that when they fall asleep, after they've been asleep about 30 minutes to an hour, they actually get these little seizures in the front of the brain. And they're usually ones that are having all kinds of sleep issues. They're not sleeping more. They're putting on Ambien, putting on everything else. If in the evening time before they go to bed, you give them a drip of nicotine, they stop having seizures every night. And so it's one of those things where they're usually not catch even on a normal sleep apnea study, because most people, I know Dr. Gee over here does, but most people don't do an EEG to see what's going on in your brain. So if they do the sleep apnea and see what's going on in your brain, they'll go, oh, you're having a frontal lobe seizure every night at that, an hour after you go to bed, and you give them a little bit of nicotine, poof, gone. So that's the one time that I think it's really beneficial. Sometimes you need to raise people's heart rate. It'll raise people's heart rate and heartbeat too, is what it'll do. Apricot seeds, B17. So this one is one that the medical world says that it's killing you, it's a bad deal. I would say this is a natural chemotherapy, is what I would say. So apricot seeds, when you break them down, they actually make cyanide in your body. So if you take them in and you're bringing it in and your bad cells have more blood vessels, they're moving faster, the accelerator's down, they're going to suck in more of it than your good cells, so they're more likely to die before you die. And that's how it works. I have had 2 or 3 patients who have used apricot seed and swear that it worked and it got rid of their cancer. So I've actually seen that myself. But in general, you're basically, whether you're going to win or the cells are going to win in taking in the cyanide. Cannabis, CBD. So cannabis and CBD, I think really the side effect of the idea that this kills cancer is not there. I can't find that it kills cancer. Where I will say this is a benefit is a lot of cancer patients become cachexic. They lose weight, they can't put on weight anymore, and cannabis tends to make you hungry. It tends to make you hungry, and it helps them put on weight. It tends to make stomachs not hurt. It tends to take down some pain. The side effect of that is it's a downer. It tends to slow down things. And so you tend to get depressed, bowels slow down, every process in your body slows down. Even your immune system slows down. You want your immune system going in the right direction, but you want the other cells to slow down. So it has some benefits, but it's weighing back and forth. In my opinion, the biggest benefit is getting you to eat food, getting you to gain weight. The idea of depression, that is a problem. In life in general, if you're doing CBD and you think, hey, I need that to calm down, to go to sleep at nighttime, or it's helping my anxiety, if you're going to do CBD, take it for a while, and it's a slow, gradual downer. And if you keep taking it, I've had the happiest people in the world come in to me, and they've been happy, and they've had some sleep problems, and they said, well, I heard CBD helps. It helps so good. I fall right asleep. I sleep all night long. Their mood goes, crashes down. The good news is, if you take it out, let's say you did it for 2 weeks, and you're going down, you come off of it for about a week, and you come back up, and you go down. So if you are needing it, you have to have it, stage it. On, off, whatever the regimen is that you need. But if you're getting blue, take care of it. Gerson therapy, starvation therapy, basically is what it is. So you reduce the calories, and sometimes it's effective. You're just trying to slow down how fast the cancer cell is growing. So if you have enough fat on board, if you have enough weight on board, you have enough reserves on board, the theory is you come in, you don't eat, the cells are really voracious, they're eating like crazy, and after a while they run out of energy, your cells are going, okay, I'm just resting, relaxing. Those cells are going, I need to eat, you starve them to death. The problem is, many individuals that start down this road, they lose weight too fast, and then their bodies junk out, and then they die. I've actually had patients who have done this, and they died. And I'm saying, nope, you gotta eat. Nope, not gonna do it. And they basically waste away and die. They probably, if they maybe would have used this in combination with something else instead of just doing that, it would have been okay, or fed themselves properly. So, ends up with nutrient deficiencies, electrolyte imbalances, and other things. CKH this one, there's no evidence on it either. There's actually even some that say it actually makes cancer cells grow more fast than what they did. I don't know a lot about it, but a lot of teas go into your body, and they're very acidic when you put them in. But when they get to your stomach, they change over to alkaline. So, for instance, vinegar. Vinegar is acidic. You can use it in formulas as acidic. Once it hits the digestive enzymes and everything in your stomach, it actually breaks into 2 parts alkaline. That's why they say, oh, take this for acid problems because it neutralizes it. It's actually alkaline. Lemon juice is the same way. You put it in, very caustic. You'll eat the enamel off your teeth. Once it gets in the stomach, it becomes 2 parts alkaline. I assume that's the way this tea works too. Colloidal silver. I've had numerous friends, patients that drink a little colloidal silver every day, and they're healthy as can be. The catch is there's no evidence to support it's cancer in here. I would say this goes back to infections. It keeps infections away. It takes down some of the inflammation and allows your body then to see the cancer and take care of it. So it's not actually killing the cancer, it's taking care of infections and doing it that way, or keeping you from getting infections surrounding the cancer so your body can focus on taking care of it, the immune system. Dichloroacetate, I really know nothing about this, but when I was looking for alternative, functional alternatives, it was one that popped up. It's shown some promising anti-cancer effects in the laboratory. When they say laboratory, they are talking about in petri dishes, so in vitro. When they talk about in vivo, that means in the body. But most of the time when they say laboratory studies, that means rats and test tube. Just know that. Otherwise, they'll say human studies. So in the human studies, basically they've had some small studies on it. It's not approved for cancer yet. This is still a new one to me. But one of the things that popped up every time I went and tried to look at it was it causes neurological issues. So I don't know anything about it, but I wanted to put it up here and just put it on the list so we're aware of it. Baking soda. This goes back to the pH. So baking soda is sodium bicarbonate. It is very alkaline. When you take it in, it pulls acid to itself and neutralizes it. I have a problem with baking soda in particular. It's all over the Facebook, it's all over everywhere, and it says, hey, take a teaspoon, get rid of your heartburn, take this, take that, put it in. The problem is, sodium bicarbonate basically pulls potassium towards itself. Well, potassium is one of the main drivers for a steady heartbeat. So the second you start putting tablespoons, teaspoons of baking soda in, you're starting to pull potassium away. I wonder how many, especially elderly people who are already potassium deficient, die in the middle of the night because they did baking soda before they went to bed. And they probably saw it on Facebook. Probably one of their friends said, oh, do this. And they did it, and they didn't wake up the next morning. We sell a formula here in the office because I think there's a place for alkalizing. When you have the heartburns come up in here, you need to alkalize it. But we sell one that's called bicarb, and it has potassium added to it. So when it goes in, it doesn't pull the potassium from everywhere else. It already has this potassium with it. And so baking soda, I think, changes that microenvironment, that changes it from acidic to alkaline, so that way your body can see the cancer and begin to fight it. Remember I talked about the sewer treatment plant and the guy jumps in there, you're going to say, no, I'm going to let him go. That's what your body says about an acidic environment. So if you can bring that acidity into more alkaline, it's good. Baking soda by itself, probably not the way to do it. Okay, tests used for cancer detection. Right now, probably one of my favorite tests out there is called the Gallery test. The Gallery test is basically a test that tests for DNA SNPs from 50 different cancers. And so this can actually test for cancer before you ever even know it's there, before anything else. You can't see it on a mammogram. You can't see it in blood work. It actually picks it up before that. I had this test done when I turned 50. They recommend that you be 50 or you have some concern of a certain cancer or you've had cancer in the past to see if it's gone, and they do it. It's not a cheap test. The test is about $950. We actually got approved to do it here in the office. We'll be doing it mid-July. And it's a good test. The issue is if the test comes back positive, it doesn't necessarily tell you where the cancer is. It tells you what kind of cancer it is, and it may only be one cell or two cells in your body. It may not be very many. So it really hasn't metastasized yet. The catch is, once the test comes back positive, you know then to start looking for that cancer because you can catch it in stage 0, stage 1. Most every cancer is curable when you catch them early on. Almost every single one. So this is one of the best mechanisms for catching early. The second thing, colonoscopies. So if you've had a colonoscopy, you probably ought to have one somewhere in life there at least. If they go in and they're finding polyps, they're finding stuff going on in there, probably good to repeat it on a certain rotation to make sure you don't have cancer. If, two things, you've had a colonoscopy and it's clean, you say, yep, they did it, I have no problems there. Or you're younger and a little concerned or issues like that, you can have a stool test done, a Cologuard test. And a Cologuard test is looking for that DNA of certain cancers in you. And it's a good, solid test to do, and I recommend it. So, the one I had a lady last night, she goes, well, I had a colonoscopy 10 years ago, and they told me I need to have one every 10 years. Should I get it done? I said, well, did they find anything in your colon? And she goes, well, yeah, they found polyps in my colon. I said, yes, go get it done. If she would have told me, no, I had a perfectly clear colonoscopy, there was no problems there, I'd say, well, then probably every 10 years, go get the Cologuard, and we'll go from there. But once you see a problem, you stay on top of it. You know, it's a situation like that. The complete blood cell count. This is a CBC. It's under $20. Pretty cheap test to run. We look at it and we can see the ratio of your red blood cells to your white blood cells, the different lymphocytes to neutrophils, to basophils, to eosinophils. We can see the size of them. We can see the percentages of them. And when we start looking at that, a one-time snapshot, it's not a big deal. Maybe you just fought off a virus. Maybe you just, lost some blood. Maybe you did something like that. And one snapshot is not a telltale sign. But all of a sudden, if I see a trend of your white blood cells dropping over time, your immune system's going down. Something's not right. Maybe you have a cancer in there that's taking down your white blood cells. Maybe your body's fighting off an infection. Maybe it's doing something else. We probably need to take care of it. So if you have cancer, we figure out what it is. If you're heading towards cancer, we stop it in the meantime. If you have an infection, we take care of it. It's such a cheap test to run. And that's why most of the time if you go to the doctor for your annual, they run it. Comprehensive metabolic panel. This is the one that basically gives us a snapshot of how your liver is doing, how your kidneys are doing, how your electrolytes are doing, how your pancreas is doing. And so it's a good one to see what's going on, just a snapshot. Another cheap one. So usually for $37 or less, $40 or less, you can run the CBC and the comprehensive metabolic panel and know a general idea where you're going. And it's just that snapshot in time, but over time you can see what it looks like. I always tell people, I said, if I went on the street and followed you around during the day and I took a picture, that's kind of what a blood test is. If one time you're going, next time you make another face, after a while I can see, oh, that's what that person looks like. You kind of get the idea what they look like. And sometimes when they're out and they take a picture, maybe they're dressed like a bum. And you think, maybe they just got out of the garden, they have poop on their jeans or whatever else it is, and you look at them and you think, wow, that person's really dirty. Well, maybe that's when you're fighting off an infection. The next time I see you, you're dressed to the hilt, everything's perfect, and I think, oh, okay, that's it. But after a while, you get to know the person. You're like, oh, that person does work in the garden and mucks poop out of the shed, and then they go out on the town and they do this here. You kind of get to know them. Same thing with those blood tests when you look at them. Liquid biopsies. These are usually ones where we go in, and this can also be a needle biopsy. We go in and we take a sample out of a piece of tissue and we go and look at it. We look for the DNA that's in it. We look at what's there and we figure out what kind of cells are in it and we can see what's there. Mammograms, taking a lot of heat both ways lately. Some people say that mammograms cause cancer because of radiation therapy. It's pretty high dose for the tissue that's in there. Other individuals say it's critical. Right now they're leaning more towards it's not as critical. But the alternatives are things like MRIs, which are highly expensive, but probably more definite, more definite on what you're getting there. There's thermographic imaging, where you come in and you basically see where it's hot and where it's not. Truthfully, every woman, every month, I don't care what age you are, should be coming in and doing a breast exam. And if you're finding anything in there that's bigger than a BB, be cognizant of it. See if it's growing. See if it's changing. One of my classes that I had when we had to do breast palpation and everything, one of the things we looked for was whether it was fixated. So if you could come in, you find a lump there, and it's very easy to move around, most likely it was either benign or just fibrous or something like that. If it came in and it was a fixated bump in there, the theory is that you have a lot of blood vessels, a lot of things coming into it that are locked it down in place and it didn't move very well. So if it's easily movable, then you said, okay, it's not locked in place. Most likely it's not a metastatic tumor or anything. Wouldn't bet the bank on it, but that's something you come in and say, well, it's been there 30 years and it hasn't gone anywhere. It's movable. Probably going to be the next 30 years, not a problem. You come in and say, wow, I got this BB here. And that little BB's only been there for a couple months and it is so tight in there. Go get it checked out, you know. Pap smears. Pap smears are where they come in to the cervix and they scrape off some of the cells there. HPV virus tends to make those cells abnormal, and they can see that on pap smear and they become cancerous. Now, I will say this to a number of my patients. They come in and say, they'll be crying and say, I just got back a pap smear that shows abnormal cells. I say, okay, we're not in trouble yet. That's not a problem. That's not even anything to sweat about. Probably 60-70% of people may throw in their lifetime one that's abnormal. And it's because that area grows back pretty fast. It has a lot of things it's doing. It's keeping out a bunch of bacteria. It's keeping out fungus. It's keeping out all this kind of stuff. And that's kind of the hub where everything hits in there. And so sometimes you've got it beat to death. Sometimes you got bugs on it. And you can throw an abnormal pap smear. You come back, they redo it 6 weeks later, and it comes back perfectly fine. Now, if they do it and the abnormal comes back as cancerous, that's a different situation than just abnormal. So an abnormal one, you don't sign off your will and give your money to everybody until you know that there's something else there, and then we still treat it and take care of it. Low dose CAT scans. So most CAT scans, most x-rays now have so little radiation in them. My x-ray machine, I was told that the radiation you get if you take an x-ray with it, you get more radiation if you flew over to Europe than you do now from this, because the digital reading scan behind it, it's called a Bucky, is so sensitive that they barely have to put any radiation through you for it to show up on the backside. The modern CAT scans are the same way. It used to be when they give you a CAT scan, it was like giving you 5,000 x-rays. I made up that number, but it was a significant number of x-rays. And so now they put in front of it low-dose CAT scan just to tell the difference. But low-dose CAT scans are nice. They can tend to get good structural with bones. They tend to see what's going on with bones. Lungs it tends to do pretty good with. Some of your other soft tissues, not as good. We go for MRIs for fluidy tissues, for things with blood flow. We go to MRIs, but CAT scans definitely have their place. The insurance world loves a CAT scan. CAT scans are cheap. They go get a CAT scan, $50, $100 for them, and so they'll send you almost every time for a CAT scan if they can get away with it. A PSA test, this is another blood test for prostate-specific antigen. It's interesting. There's actually some women that will have a PSA that'll get elevated. Men and women have a lot of the same parts. They're just rearranged a little differently. And so there's a Skinner's gland in women, and if it gets problems, it'll show up that way too. But nobody ever tests for it. But PSA, a lot of times your PSA will go up in men if you get an infection in the prostate. It'll go up if the prostatic fluid gets locked in there too long and it just starts getting hard. It'll go up. If you go bounce on the tractor, like somebody hitting with a hammer there, it'll go up. It goes up if testosterone is too high. So you get people on hormone replacement therapy, even a young guy, it'll start raising up there. So it's just a measure to see what's going on in the prostate, whether it's growing fast or whether it's shrinking that way. Skin exams. I already talked about skin cancers and how important it is. If you come in to see me and you have a place, I look at it, and if I have questions about it, I send you on to the dermatologist because I know, hey, I'm seeing the tip of the iceberg. We're trained in dermatology, but I'm not the expert. But I will say this, if you have a patch that is smooth, it's the same color all over, I'm not too worried about it. If the patch is rough around the edges, if it's not a perfect round, smooth cell there, and the color's different, if it's splotchy on it, those are the two main warnings. Go get something done about it. And so when you look at it from a standpoint of cell division, if the cell is just dividing normally, it divides evenly, and it makes a perfect circle as it rounds out. If it's the same cell dividing, it makes the same color. So same color, same smooth surface, not too bad. It's like a nevi of a common mole. If it starts to grow and it gets one side's growing faster than the other, and it looks like it's growing in different directions, and all of a sudden the color's different, time to get it checked out. You're seeing the tip of the iceberg. Imaging, MRI, Like I said, very good for seeing fluid-based tumors in that. Your CAT scan again. Your PET scans. I didn't mention PET scans. PET scans is when they give you a sugar-based dye. The dye holds sugar to it. And remember, your cancers are very voracious. They're growing super fast, and their favorite fuel is sugar. So you put that into somebody in their IV, you give it to them, you go and do a scan, and it shows up on the imaging. And it usually bright glowing on the imaging the way they have it set up. And so PET scans are very good for detecting where the cancer has moved to. So you're looking for metastasis. You come in, you say, okay, yes, you had prostate cancer. We've taken some x-rays. We're concerned it may be in the bone. We're not for sure. You go get the CAT scan, the PET scan, and it shows yes, no, it was in the bone. The other place PET scans come into very good effect is if maybe you have metastasis, so it's spread to multiple places in the body, and you're taking a therapy, immunotherapy, chemotherapy, whatever it is, and you want to see whether it's working or not. You come in, and sometimes they'll do a baseline PET scan before you start your therapy. They wait a month or two, they come in and they do another PET scan, and they say, look at this, it's better, we're doing good. Or maybe it says it didn't change, or maybe it says it got worse. We needed to change everything we're doing. We're going to throw that out and we're going to start all over. So PET scans are really good for determining how well your treatments are doing and how much the tumors have spread. Insurance companies do not like to pay for PET scans. They like to come up with every reason in the world not to pay for PET scans. Kind of a bad deal. In our office, things that we offer here, we will be offering the Gallery test here in mid-July. The truth is I can offer it now, but for some reason when they sent me all the test kits and everything, they said it's going to take 6 to 8 weeks to set up your testing thing. So right now my cost for the test is double of what it's going to be in 6 weeks. I have no clue why that is and how any company can survive taking 6 weeks to set up an account. But so be it. I have the kits back there. I just don't want people to pay double for it. Comprehensive metabolic panel. That's one that just says generally how we're doing cheap tests. CBC is a cheap test. That FMV test, I'm going to talk a lot more about it next month in mitochondria, but the FMV test, it really tells overall function of the body. So first of all, it gives you what's going on with all your vitamins, your B vitamins, A, C. It also tells us what's going on with the oils, the omega-3, 6s, 9s, 7s, all that in your body. And it comes in, it looks at all the breakdown products in your body. And so it tells us, hey, you're having a problem digesting food here. It's not working like it should be. You're having a problem processing carbohydrates. You're not doing methylation right, so you're not using your B vitamins right. Over here, you have arsenic, you have lead, you have mercury, all these things that control how well your body's cleaning out stuff. And so that's not a cheap test. I think that test is around $700. But for general people looking for longevity, to want to see how long they can live, what they need to do, this tells us how dirty you've been in getting toxins in your body. So it's a good way to say, yeah, we got to clean up some stuff here. Sometimes it's goofy. Sometimes it'll come in and it'll be, oh, you need a lot more biotin. For some reason, you're taking it or something, but you need double the dose of somebody else, and you know it that way. I had a lady, one of my patients from New Hampshire, in January, she requested a longevity workup, and she spent some money, and she got this and other things, but this came back, her mercury was 36. 6 is considered extremely high. 36 is considered pretty much fatal. And it gets into your brain and everything else. I would have never guessed in my life she had a mercury problem. Would have never been able to guess it because incredibly smart, works in international banking, and that came back. We retested it. Yes, it was there. So she's getting chelation therapy, which means pulls the metals out of you. She's been doing that since January. She's only down to a 16. And so when we go back and reinvestigate it, she was eating salmon and tuna every meal for the last 5 years or so. So she loved it, and she just ate it for every meal. And that's how she got all of her mercury in. And she does say, she goes, I don't feel, I guess, great, but she goes, I can tell that I can think clearer and overall have more energy. So that test probably saved her life. I think she probably, with where she's at, probably wouldn't have been here in 5 years. And she's probably 52, 53 years old. So she probably wouldn't have been here. We do genetic reviews. We have you go out and do ancestry DNA because it's the cheapest way to get the most volume of DNA. So you go do ancestry DNA every holiday. They put it on sale. Even St. Patrick's Day, they put it on sale. They just finished it up for Father's Day, but they put it on sale for $39. You go on there, you sign up just for the kit. They send you the kit. You spit in it. You send it back. And I do know that they send you a lot of things. Hey, sign up for our website. Do the subscription. Don't do it. There's no need for it. You don't need it. In about 4 to 6 weeks, you get back your results. And it says, basically, you're related to this monkey's over here and this monkey's here and everything. You can choose whether to share that with the world, or you can say, nope, I don't want my data out there. I just want to keep it. But the important part, you go up there in the DNA settings, you download your raw DNA data. This is your raw DNA data. You send it in. If you're a patient, we go over it for you. It's part of the service here. And if you do it with your initial visit, it's free for you. Otherwise, I got to take it and I charge you $75. But for $20, $110, you're getting about $30,000 worth of information out there. And so I'm looking for the cancer genes. I'm looking for the detoxifying genes. I'm looking for the methylation genes. And so I'm trying to see what's broken in you so we know where to turn off the gas pedal, where to put back on the brakes and that kind of thing. And that's a cheap thing. I ought to charge more for it than I do, because I know, like, the hospital, on all those tests, they're charging like $1,000 a piece, literally for $110. But I think it's so important that when you do it, I can help you set up a longevity plan. So I think it's very important. X-ray. We do X-ray here in the office, and there's been times where I've had people come in, they were lifetime smokers and stuff. We take an X-ray and we see things in there that we find, or bone tumors, things like that. We send them off to a DACPAR, which is a chiropractic radiologist, to review them and make sure that everything's okay there. We do the individual lab tests for different things. If you come in and you say, hey, I'm urinating too much, I'm having what I think is a prostate problem, we run that test. We can run other bracket tests, things like that. And then we send a number of people for outside imaging, for CTs, MRIs, and that kind of thing. So, I wanted to get this in one last time. General lifestyle strategies. Regular exercise, boosts your mitochondria, gets oxygen where it should be, lets your body know you're alive, moves the lymphatic fluid. Balanced diet, rich in fruits and vegetables because they're antioxidant. They also make you a little more alkaline. High fiber diets because it keeps stuff moving through your diet, through your thing. Protein is important. Adequate intake of B vitamins, CoQ10, selenium. Limited processed foods, and get rid of the excess sugar. In the United States, the processed food and the excess sugar are our biggest things. And we have individuals working hard on that, and it's going to change their life. Stress management. Reduce that oxidative stress. So, don't be getting the poisons into you. Take that time to walk around, look at the things out the sidewalk, that kind of stuff. Basically, meditation, yoga, sleeping good, that'll make a difference. Adequate sleep. If you're one of those people that thinks you can go without sleep all the time, you're shortening your life. So your cellular repair has to happen when you're sleeping. You don't repair certain things. It also just lets you heal in that. So you rest, digest, and heal. Minimize your toxic exposures. Limit the things that you're putting into your body, the smoke, the pollutants, the herbicides, the pesticides, the cleaners, that kind of thing. And even your excessive UV radiation. So don't go spend forever in the tanning beds. Don't have an office where you're sitting by the radar machine, that kind of stuff. Toothpaste. This is an interesting one. So toothpaste, formaldehyde, has been known to have some detrimental things to you. But also, toothpaste in general, a lot of them kill all the bacteria in your mouth. You produce most of the nitric oxide in your body in your mouth. This is what lets your blood flow properly. It keeps chemicals down. And so, I mentioned before about making toothpaste, but just making sure you get one of the cleanest, most natural toothpaste you can. In the past, I've made toothpaste with organic coconut oil. I put in some baking soda in it. I put in just a touch of turmeric, and then I put some mint oil in for flavor. Mix it up when it's warm, and then when you get ready to do it, you can just take your toothbrush, put it in there, scoop it, brush your teeth with it. You'll have actually the whitest teeth you've ever had, and you won't kill all the bad bacteria. You'll get good bacteria in there. The only problem with that formula is it's yellow. So if you happen to scoop it in there and you have a white shirt on, you drip it down your front, it's going to turn it yellow. So clean over the sink. Proton pump inhibitors. They have a purpose in life. Your omeprazole and those, you're only supposed to take them for 10 days. There's a reason why there's a warning on the package for more than 10 days, is because it messes up your pH. Goes into your stomach. It makes your stomach not put the acid in the stomach. It's still making acid. It pumps it out into your bloodstream. Your bloodstream, remember, is going to stay in that range, right around 7. So it's going to push that acid out to your tissues. It's going to push it to your kidneys. It's going to push it to other places, and it tends to cause acid. There are better ways to take care of this. I gave a talk on digestive health and that, and it's all in there. But if you're having that problem, come see me. We'll talk about it. If you enjoyed this, go give me a good Google review. I appreciate it. I spend probably 24 to 30 some hours working on this presentation, and then usually, setting up the room, because this is usually my rehab room, and doing all that. I probably have I almost have a week's worth of work in giving these presentations. So if you like it, that's how you pay me back. I'd appreciate it. If you want to see the other seminars, because a lot of you have been here for a number of these seminars, but go to thelegacyclinic.com. It's a website here. Click on the video link at the top, and it will take you to clinic seminars in YouTube, and you can see any of them you want to there. And then you can subscribe, and it'll let you know when new ones come out. And this one will probably be up in a week or two. So I think that's it. That's it.